Dr. Ghazi, Regional Representative for Middle East, Dr. Al-Husseini, Director of Sub-Regional Office, Dr. Asaloon, Chairman of the Regional Committee, country delegates, all participants. Good morning in the second day of this conference. This session will be all about wildlife health. OIE considers disease surveillance in wild animals, including both terrestrial and aquatic species, to be just as important as the surveillance in domestic animals. Pathogens in wild animals affect domestic animals' health to trade in animal or animal product, also affect to human health and to wild animal population themselves, which often have very high economic and social and cultural value. This session will present to you in details the OIE Wildlife Health Framework and the importance of wildlife surveillance and reporting. I have the pleasure to invite Dr. Sophie Mossi, who is the EPO-SORCI Project Coordinator and Program Manager for the OIE Preparedness and Resilience Department, and Dr. Rupert Woods, member of the OIE Working Group on Wildlife and Chief Executive Officer for Wildlife Health Australia, which is the peak coordinating body for wildlife health in Australia, to lead this session. Dr. Mosier, the floor is yours.
Thank you, Dr. Samar. I'm going to share my screen. Do you see it? Yes, perfect. Good morning, everyone. I'm pleased to be part of the conference today, and I'm going to talk about the OIE Wildlife Health Strategy. And I would like to start by highlighting several actions that the OIE has been taken in the past few months related to wildlife health issues. Especially the OIE integrated wildlife health issues in the 7th strategic plan, especially under 2 objectives: scientific expertise and collaboration work with partners, which are 2 areas of focus for the wildlife health framework. And I'm going to talk a little bit more about that later. Last May, during the World Assembly of OIE delegates, a resolution was also voted, the resolution number 31. And the resolution highlighted the importance of investing in wildlife health, as it has been the case for domestic animal health in the past decades. It also showed the role of veterinary services and how they could take a leading role in better integrating wildlife health into the One Health agenda, and in partnership with the environmental sector and wildlife and conservation actors in the area. There were also a statement issued on wildlife trade and disease emergence by the Wildlife Working Group right after the start of the pandemic. And another group was started to work on guidelines on managing risk through wildlife trade and along the supply chain. So that was really the beginning of a more broader program that will address wildlife health issues. And I'm going to detail that a little bit. So let me go back a little bit into the development of this framework, which has been a consultative process. A draft has been developed at the OIE HQ in collaboration with our colleagues from the regional representations and input from the Wildlife Working Group. We also consulted our membership through a survey that was sent in June 2020. To collect feedback and making sure that what we were proposing were actually aligned with members' expectation and needs that allowed us. And it was interesting to see that we were quite aligned with the membership, which was great. We just had to do a few adjustments. We presented the result of the survey in a webinar in November 2020. We then conducted a consultation of stakeholders and mainly our partners who are also working on this topic, namely IUCN, CITES, FAO, WHO, for example, and UNEP. And finally, we finalized the document in December 2020, and we disseminated it to our members. So what is the Wildlife Health Framework? The goal is really to protect wildlife health and embracing One Health with 2 main objectives. The first one is more responding to public health concern, and the OIE aims to support its members to improve their ability to manage the risk of pathogen emergence in wildlife at the human-animal ecosystem interface. The second objective responds to more conservation concern, where the OIE aims to support its member to improve surveillance systems, early detection, notification, and management of wildlife diseases. How are we going to do that? By focusing on three main areas of work, which were identified as priority and essential to actually achieve these objectives. The first one is strengthening One Health and multi-sectoral collaboration and capacity for wildlife health management, monitoring and surveillance systems. Second one will be promoting a political, policy, and scientific environment that allows veterinary services to implement effective wildlife health monitoring and management. And the last one is focusing on increasing awareness and knowledge of risk pathways and best practices in wildlife health management. So these three streams are going to be fed by the work conducted through 6 work packages. And as you can see, these packages are really aligned with the OIE core activities to make sure that the OIE really integrates wildlife health issue into these core activities. One being really, of course, as a standard setting organization, we're going to focus on standards and guidelines to assess if there is any gaps and we can do any improvements in better integrating wildlife health issues into the current standards and guidelines, assess if we need new chapters, for example. Another area of work that this framework actually gave us a very good opportunity to review. It's a disease notification of non-OIE listed disease for wildlife, which has been a challenge for members for a long time. So this framework gives really an opportunity to review that system and make sure that disease notification, wildlife disease notification benefit both members and the OIE. The surveys that we conducted in June 2020, as I was saying, mentioning it earlier, highlighted the fact that veterinary services needs more capacity in wildlife health management. So it's going to be also an area of focus. Of course, these new pathogens and wildlife diseases comes often with gaps in knowledge. And so it's really important to develop new scientific knowledge in these areas to better understand transmission pathways, especially on the interface between livestock, animal, and ecosystems. And also this scientific knowledge will of course feed into the development of guidelines and standards and to feed into curriculum in our capacity building activities. Wildlife is often seen as a threat. Rather, it should be seen as an asset for ecosystem health. And so communication and awareness is important amongst other tools, but it's going to be a big part of this work as well. And of course, the OIE cannot achieve all of that by itself and needs partners, and multi-sectoral coordination and collaboration will be a key element to achieve these objectives and will be actually applied through the 5 other work packages. We have developed strategies for implementing a strategy to implement this framework. That's basically will be done in 3 kind of steps, and that will address the 2 objectives at the same time, or simultaneously. The first important thing is to really start from a solid foundation. So we're going to conduct stakeholder analysis, need assessment to have a strong baseline that will help us to really design fit for purpose tools or update current material that already exists. There are already a lot of tools such as workshops to improve collaboration, existing standards. And so the idea is not to produce new things, but look at what we have, improve them, and why not, if needed, produce new things. And then at the end, of course, these tools and material will be disseminated and implementing, hopefully at national level. Along this pathway, we acknowledge the fact that our wildlife focal point network is a wealth of knowledge, and that And we know that we already have wildlife focal points who are already very involved in our work, and there will be an opportunity for them, for those who would be interested, to contribute to the development and the implementation of these strategies, so they can be our champions, but also while benefiting from the products and tools themselves. So we are still working on the mechanism to involve them, but they also have been involved through a recent survey that actually has been sent recently, and I would like to thank those of you who may have responded to the survey to assess the need for training and in surveillance capacity in countries. So you may wonder what we have been doing since December, since the release of the framework. We have been working to try to transform this framework into a functioning program. And so to put some structure, raise funds, we set up a wildlife team at HQ and recently added our colleague from each region. So we have better coordination of the different initiatives. We have been working on securing funding, and I would like to take this opportunity to thank our donors who allowed us to start early activities, such as the government of Australia, the government of Germany, US CDC and WHO. I hope I don't forget anyone at this stage. We have been working on developing 5-year implementation plans with deliverables, identifying who is leading the activities. We're still working on developing indicators for each activities, which will help support the monitoring and evaluation of the program. And of course, it came with prioritization of activities based on our human resources, funding, but also priorities that were identified by members through the different surveys that we have sent out. One last important component who have been trying to, not trying, but who have been actively involved is to liaise and coordinate with other initiatives and partners. As you may know, the current landscape is really busy with different initiatives pertaining to One Health approach, zoonotic risk and prevention. And so it's really important and key that the OIE keeps being involved in those discussions to identify synergies, avoid duplication, and ensure global coordination. So I think I'm going to the end. I just would like to say that we are just launching a few activities, a review of the legislation pertaining to wildlife health, the development of e-module related to wildlife surveillance and wildlife trade, development of guidelines on risk around wildlife trade. So a lot of exciting things are happening and are going to happen in the next month. So stay tuned for more developments. Thank you very much for your attention. And I will leave the floor to my colleague, Ripper Wood now. Thank you.
Okay, thanks, Sophie. So what can you see here? Can you see my presentation, or can you see the presentation with the notes page?
It's okay.
It's fine. Terrific.
Please.
All right. Well, thank you, Sophie, and hello, everyone. May peace be upon you. And thank you for the invitation to speak with you today. So we have 10 minutes to talk about surveillance and reporting for wildlife. And what I'll do briefly is tell the story of our system and how we tackled this, talk about some of the benefits of our approach, and then I'll hand back to Sophie to run us through some questions using Menti. And what we're most interested in are your views on the OIE Wildlife Health Framework, which we've just heard about, and also gathering insights into your experiences with communication and working with wildlife stakeholders, which relate to my talk. Okay, so let's start with the Australian story. So about 25 years ago, we had a look at our animal biosecurity preparedness arrangements. And in doing so, we realised that we had a potential vulnerability around wildlife health, and work was needed to strengthen how we addressed this area. The vulnerability arose because most of our wildlife health data at that time did not flow through our usual biosecurity surveillance and reporting channels. We didn't have a linked up system, and we needed better line of sight or visibility into the wildlife compartment. So what did we do? Well, we set up a system, and our system is based on the intelligence cycle. It's simple, national, and functional, and it's embedded in our broader biosecurity arrangements. The system relies on the collection, analysis, and dissemination of information, with direction being provided by a senior governance group. Core business is surveillance and reporting to support trade and market access. The system also supports surveillance and reporting for environment, biosecurity, and human health concerns. The system is complex. There are inputs and outputs. Some things are brought into creation and some things change. But ultimately, it's an intelligence network that's made up of people. Lots of people, both government and non-government. With the focus being on bringing the main sources of non-government and non-biosecurity type wildlife health information into our national animal biosecurity arrangements, such that it can provide linkage and information needed to support decision-making across all areas of government. Main output is surveillance and reporting, and the system succeeds only through communication and working with wildlife stakeholders. So for those of us who are struggling with how to tackle the risks posed by wildlife to our countries, that's how we tackle things. By exploiting the tactical opportunity available to ensure linkage between animal biosecurity and other areas, primarily environment and also human health, using networks as the enabling mechanism. In reality, this primarily meant bringing non-government sources of wildlife health information into government processes by utilising frameworks that we already had in place, or where they were not in place, by building them. And the benefit of this approach was that it provided line of sight for our senior people to a potential area of strategic vulnerability for the country relatively cheaply. It ensured that coordination across government occurred and that there were no surprises. So that's how we tackle things, or how one country tackled things. We're interested in your views on the OIE Wildlife Health Framework, communication and working with wildlife stakeholders. So I'll hand you back to Sophie to ask you some questions, or begin asking you some questions through Menti. So thank you, and back to you, Sophie.
Thank you, Roop. Since there is no question in the chat, I think, yes, we can go to Menti directly. So I think Natalie is going to share the link in the chat so you can connect. And I'm going to share my screen. So, can you see my screen?
Yes.
Okay. So we are going to ask you 4 questions. The 2 first one will be a link to the first presentation on the wildlife health framework. And the 2 second one would be related to the presentation on surveillance. I'm going to leave you a few minutes so you can connect. And going to the question slowly to the OIE wildlife health strategy. If you have any problem connecting, feel free to mention it in the chat and one of our colleagues will help you, hopefully. So I don't see who is connected. So Natalie, let me know if you have the ability to see that. I'm going to move to the first question while letting people connecting. So when you click on the link that is on the chat, you will be prompted to a new page where you can see the question, hopefully. So the first question will be, which of the wildlife health framework objectives are a priority for you? So I presented you the 6 work stream or area of work, which are called as well objectives here, but this is basically the 6 ones we are talking. So which one are priority for you? So the first one is promote multi-sectoral coordination and collaboration. Second one is strengthen capacity in wildlife health management. The third one is improve quality data collection, reporting, analysis, and news. The fourth one is update and develop guidelines, standards, and risk reduction strategies. The fifth one is develop and disseminate scientific knowledge. And the last one is basically communication and awareness. So I'll let you connect. You can see that we have 5 responses already. Looks like number 2 and 3, capacity building and notification coming first as priority. I'm not sure I can see what's going on in the chat, so let me know if there is any important information that I am missing. No, okay. So we have 11 responses, 12. Capacity building is still coming as a first priority, along with disease notification and intersectoral collaboration. They could probably need more minutes. I see that more people are able to connect. That's great. Confirming the trend here. So we have 15 responses. Are we expecting more? Or shall we move to the second question? Yes, there is more coming in.
Just the same regular toppings as you put on a regular pizza. No, it's so big and it has cheese.
So it really looks like capacity building Disease notification, data management, and intersectoral collaboration are the three main objectives here in this region. While standards and guidelines are the lists, and communication is the list of a priority, which is an interesting information to have. Okay, shall we move to the second question? Is 18 a good number? Yeah, okay. So the second question is, based on your previous response, so based on the priorities that you identify in the previous question, which one do you actually plan to implement? Because you have the human resources, the funding, and the capacity to do it, basically. So again, we are covering the 6 same areas: multi-sectoral collaboration, number 2, capacity building, number 3, disease notification and data management, number 4 will be guidelines and standards, number 5, scientific knowledge, and number 6 will be communication and awareness. So again, which of the prioritized wildlife health framework objectives that you identified in the first question do you plan to implement? We ask that question because sometimes you have priorities, but you actually cannot implement your priorities, which could be an issue. And it's interesting for us to know if actually your priorities are aligned with the capacity of implementation. So it looks like it's quite aligned with the first question, which is great. We have 16 responses. We are going to wait a little bit more and then go to the third question. It looks like capacity building is a priority that could be implemented, along with intersectoral collaboration and disease notification. So it's again quite aligned with 18 responses, quite aligned with the first set of questions. So I guess we have 18 responses. I guess we can move to the third question. So I will leave the floor to Rupert now.
Great, thanks, Sophie. Okay, so we've got priorities for the framework: capacity building, improve quality data collection, reporting analysis, intersectoral collaboration, standards and guidelines being the lowest priority, which is interesting, and those that members wish to implement: strengthening capacity, promoting multi-sectoral collaboration, improving quality of data. And again, interestingly, the lowest priority was to produce and disseminate awareness and advocacy tools. Okay, so I've got 2 questions. The first one is, what are the challenges in communication and working with other wildlife health stakeholders? And my second question is, how can these challenges be overcome? So we'll go to the first one first. So what are the challenges in communicating and working with other wildlife stakeholders? And this is a bit of these questions are a bit of freestyling. So you'll get a free text field that you can just type in what you think the challenges are. So they might be things like, we have no challenges, or it might be lack of systems, or it might be coordination, it might be capacity, it might be funding. You may have many challenges specific to either yourself, your circumstance, your agency, your organisation, or your region. So I've got a few coming through now. Project ownership and lack of capacity and knowledge. That's interesting. Variety of diagnosis, diagnostic procedures and research studies. Other challenges: collection of data and records from wildlife, lack of awareness, funding. continuous coordination with all government agencies, as well as financial funding and support, different stakeholders, different priorities, lack of communication between national agencies. These all sound very familiar, and not just for the wildlife space, but for any sort of coordination across any issue that impacts on multiple different agencies and organisations. Lack of disease reporting system, poor knowledge of wildlife disease. Common endpoint for information collection sharing. Bureaucracy, standardisation, and harmonisation in sampling and diagnostics. That's interesting, isn't it? That given the lack of priority for standards and guidelines. Lack of sufficient knowledge, resources, priorities. What do we think? Have we captured most of the most of your concerns and what you feel to be challenges? I think we're pretty close to having some feedback from everyone, and we'll collate all these as part of the report for the meeting, so that you can see what the main issues are. But to me, it seems those concepts of coordination, perhaps standardisation and communication across agencies are the main considerations. So let's cut it off there. Thank you, everyone. And let's move on to our next question. So given you've identified these challenges, how do you feel that these can be overcome, either within veterinary services or with assistance from the OIE? So what is it that you think that you can do about it, or what do you think the OIE can do about it, either within veterinary services or through some other mechanism? Protocols, agreed operating procedures, memoranda of understanding with stakeholders, perhaps, guidelines about diagnostics, more reference laboratories for wildlife diseases, so that capacity building issue again. Standards, training. Coordination between OIE and international veterinary services. Capacity building again. Awareness and advocacy. Guidelines, sharing protocols, proficiency tests. Again, I don't know about others, but this is interesting to me, again, because the areas that we feel are perhaps most useful, I think we rated standards and guidelines the lowest priority. Yet the message I'm getting from this is that they're actually potentially part of the solution. Promoting joint planning and integrated strategies, joint key performance indicators, workshops, gathering of stakeholders, more of that coordination. Sustainable budget for the OIE wildlife focal point within each vet service. maintaining knowledge continuity, that loss of corporate knowledge as senior people move on. Integrating wildlife farms and reserves with livestock disease reporting, encouraging teaching in vet curriculum, test validation. These are all really sensible suggestions. Collaborating between competent authorities. This is without question a preferable option. Nice work. We might just, can we just scroll down a little bit more there to see what else is coming in? Consolidation of goals based on each region. So we need to tailor the solution to the particular needs of the region and focus on communication with the authority in the countries involved. So again, these are really useful messages, and they seem to be fairly consistent across at least each of the regions that I've been involved with and the feedback that that I've seen. So we might leave that there, I think, unless there are any last takers. Anyone have any burning things that they'd like to say and they're going to regret if they don't speak now? No? Terrific. All right, let's leave it there. So from what I can see, the challenges seem to be, again, around that coordination capacity, resourcing is in there, systems, processes, challenges, again, getting organised at a regional level, but also at a global level, and perhaps seeking direction or having some very clear guidelines or standards or operating procedures and assistance from OIE. So before I go on and seek any other questions, Sophie, is there anything you'd like to mention about that feedback, or perhaps from Dr. Elwa?
Thank you for giving me the floor. It's true that both Sophie's presentation and yours were very interesting, not only for me, but I'm quite sure for all the participants, because according to the participation of participants in the interactive session and through the chat, I do think that it was a relevant topic for our conference today. Yeah, that is an important topic, perfectly highlighted by you and Sophie. Veterinary services must be involved in surveillance in wildlife. I know that in many countries, such a surveillance is not directly under the authority of veterinary service. That is why collaboration with other departments is so important, to have this interaction between the relevant authorities. I have also well noted the need for capacity building, including for staff working within labs, and therefore the next presentation and the next session on workforce will be certainly also very valuable to highlight what the OIE can provide as support to our members. And I also noted through the first question, if I'm right, that the second most important expectation or things to do to improve our capacity in managing wildlife health is notification. And I do think that it's very interesting to have this feedback from our members, because very often the first reaction when we are talking about notification of events in wildlife is, oh la la, that could have an impact on our trade activities. And therefore, of course, that is certainly interesting to be better informed on what is the situation in wildlife. but notification is not so easy to do. So therefore, I think that progressively members, authorities think through another way because they know that we cannot continue to neglect what is the situation in wildlife, because that is really a risk for the domestic sector as well as for the public health, while at the same time, we have also to consider that wildlife and wild animals must be protected, because the biodiversity is very important, and that is also an asset for our own future. And the protection of ecosystem is also something that we have to take into consideration. Therefore, we are at the, not at the starting point, but we are not very far advanced in our activities. But I'm quite sure that in the coming years, that will be a high priority on our respective agenda. Thank you, Rupert, and thank you, Sophie.
Well, thank you, Dr. Eloy. Sophie, do you have any additional comments?
Thank you, Rupert. Very quickly, I just would like to highlight, and it's interesting to see that communication and awareness were not a top priority, but I think that is really key. And actually in the challenges, it was highlighted as a challenge, like communication, coordination, and communication really is at the heart of often, you know, project failure, for example, because there is a bad communication. So I think it's important as well if we want to change mindsets and, you know, see again, like the importance of wildlife health and wildlife in general, to work on communication and raising awareness about things that maybe people are not aware of or completely, you know, familiar with. So as part of the wildlife health program at the OIE, it's going to be an important area of work. And of course, will be informed about the development of it, but we're going to develop a strategy and see how, what are the key elements that we want to highlight here. But yeah, I just wanted to highlight the importance of communication and awareness to, you know, move forward and change, implement change.
Okay, thanks, Sophie. Well, we better move on because I think we've only a few minutes left. But one of the things Dr. Mohammed asked if I do is just say, pass on a few closing remarks. And really all I would like to do is to reiterate the sentiments of Dr. Eloy. So wildlife and the risks they pose is a problem for us all. There is an immediate need for us to act as good global citizens to contribute to the solution. We know that every country's biosecurity system will be different, but the need for rapid and timely access to information and intelligence remains the same, whether this is for a small project, a local area, a state, territory, the country itself, or to ensure regional or in fact global situation awareness. Networks and communication and working with other wildlife health stakeholders are potentially part of the solution. And the OIE Wildlife Health Framework is a significant global enabler that needs to be supported by all parties as a global priority. So well done to all our delegates and the focal points in supporting the OIE initiative on wildlife. Well done, OIE, for your vision and leadership in this area. If in doubt, report and then report again. And if you're in doubt and you don't want to report, pick up the phone and call the OIE and ask if you should report. Thank you, everyone. And back to you, Dr. Samar.
Thank you very much. Actually, it's me taking the floor now. So thank you, Dr. Musée and Dr. Rupert, for this interesting presentation and an interactive session. For the next topic in the agenda, the veterinary workforce development, I'm pleased to invite Barbara Alessandrini, the head of the OIE Capacity Building Department, who will chair and lead this session for you all. Barbara, the floor is yours.
Good morning, good afternoon, and thank you very much for inviting the Capacity Building Department to run this session. In the next hour, we will speak about workforce, and I'm happy to liaise with the session that has just concluded, in which we have clearly understood that capacity building is a clearly identified and urgent need. So today we're going to discuss and explain a little bit more in depth what the OIE does in terms of workforce capacity building, but most of all, assessment and development. In this session, I will share the floor together with some colleagues. Dr. David Sherman. David Sherman works at the Capacity Building Department. He is program coordinator for the Veterinary Legislation Support Program, the Veterinary Educational Establishment Twinning Program, the Veterinary Statutory Body Twinning Program, and the Veterinary Workforce Development Program. Then we will listen a presentation from the colleague Jennifer Lasley, who is Program Manager for Sustainable Laboratories in the Preparedness and Resilience Department of the OIE. And Jennifer works on building laboratory sustainability and capacity building efforts, focusing on competency and curricula development, leadership for laboratories, business analytics for data-driven policy, laboratory preparedness, and other issues linked to laboratory services. We will have an interactive session, which will be led by our colleague Sonia Fevre. Sonia is program manager here at the Capacity Building Department for the Workforce Development, and she has an extensive experience in training and capacity building around livestock themes and international development in multiple regions. So allow me to share the screen. And please confirm that you see my presentation full screen. Maybe now you should see it full screen.
Yes, it's perfect.
Okay, so we will speak about the OIE services for capacity building. We will talk about workforce assessment, laboratory networking, and capacity building for laboratory. We will have this interactive exercise, and we will share the final comments on what has come up from this region with the president of the OIE Regional Commission for the Middle East, Dr. Fajer Al-Salom, which I thank you for accepting the invitation to share this final remarks moment with us. So the capacity building tools at the OIE, let's consider that when we speak about workforce assessment and development, we must be capable to identify the needs for workforce, both in terms of individual competencies and most of all in terms of management, in terms of competent authority, planning and development. We need to know what kind of professionals we need, veterinarians and not only, of course. We need to set a legal, regulatory and educational frameworks at work that can provide and support workforce development. And we also need to have clear planning of what these people are expected to do. So we need to have clear qualifications, job descriptions, and of course, we need to have competent people. How do we support our members for these objectives? We do support them thanks to the PBS and the training platform. They are two flagship programs for the OIE that work in an integrated way. From one side, we have the PBS, and the PBS provides services targeted for one single member. They are services that go into the country and analyze the situation of the country and support the country. The training platform has to provide a global access to training for individuals, but at the same time, it offers learning opportunities that members can use to plan their own annual capacity building plans. So they are integrated and they work in combination. I will be very short in describing the PBS support because the next presentation will go more in depth on that. But when we speak about workforce assessment in the PBS, you know that we do have this kind of evaluation in the evaluation step and in the planning step. We do identify workforce, we do work on, assess the needs for workforce in the PBS evaluation, in the follow-up, but there is also assessment of needs in the capacity, in the gap analysis, and new tools will come soon. But the services that are more specifically targeted for workforce are in the targeted support step of the PBS. So there is support for legislation, there is support for regulation, and there is support for education. And these services are available for members upon request from the delegate, as you know. I will spend a few more words on the training system of the OIE that we are building. We have started to build a robust system in 2018, and this is of course a work that hopefully will never stop because it's a continuous improvement work that we are developing to increase the learning opportunities for our members, which is the purpose of this system. The purpose is to empower veterinary services, and let me say, not only veterinary services. You've just heard a number of comments in the wildlife session in which the need to build capacity and the need to communicate with other authorities has been clearly expressed. So we target mainly veterinary services, but for some specific issues, wildlife, but also aquatic, One Health, many others, we do intend to build, and we already do, we want to build with other competent authorities to have a joint workforce capable to address the needs, the emerging and re-emerging needs. At the same time, we want to offer an equitable access to learning opportunities for professionals of veterinary services, and not only, as I said. We're not a common training school, of course. Our knowledge management, our learning opportunities are mainly referred to the implementation of the OIE standard. So what we do develop has this main purpose. So we do not offer everything under the veterinary domain, of course. We are concentrated on enabling authorities, on enabling veterinary services in using correctly, applying correctly the OIE standards, and to learn more about the OIE knowledge, broadly speaking. What is our target? Of course, veterinary services, as I said, but not only veterinarians. We also address learning opportunities for veterinary paraprofessionals and also for the other competencies, the other profiles that are today needed for to have functional, efficient, and effective veterinary services. But in some cases, we extend our training offer to other kind of stakeholders for those issues that require an integrated approach, an integrated building of capacity. We have organized our knowledge around 16, we call them competency packages, that belong to the competency-based learning framework. What does it mean? It means that we have organized the OIE knowledge around 16 different main domains, technical items, that are for sure single domains, but these boxes are not closed. It is a matrix, because each box will have core domains, core technical content, and at the same time, transversal knowledge. So each of these boxes is intended to be a repository of learning opportunities, but also in connection with the other ones. I want to describe them one by one because at the end, we will ask you to prioritize among these competency packages. The number one is dedicated to the OIE and its functioning. The number two is dedicated to the quality and the management of the veterinary services. Then we have one CP on risk analysis, one dedicated to laboratory services, one is dedicated to animal health management. Then we have emergency management, animal welfare, prudent use of antimicrobial, AMR to make it short, emerging risks, partnership and communication, One Health, trade, food safety, animal health economics, aquatic animals, and wildlife. So they are 16, and the yellow ones are the ones in which we already have some modules available, or we will have soon because they are in the pipeline. When I say soon, I mean 2022, 2023, and onward. We do develop new resources, new modules, OIE modules, but at the same time, we are building a system that will allow us to identify and offer also in partnership with our partners and collaborating centers, laboratories of reference, whoever will want to liaise with the OIE to share their learning opportunities for the purposes of our training system. And of course, to do that, we need to check that this training offer respond to the OIE quality criteria. OIE quality criteria that have been summarized into guidelines for the development of e-learning modules that are available online in our OIE training portal. Our training offer will be based on these competency packages, and for each of these competency packages, we will have what we call terms of reference, meaning that we will have identified in detail the technical domains, the link to the PVS, the link to the OIE standards, and we will define up to the more detailed learning outcomes for the different target audiences at different expertise level. So we will have day one, day two, expert levels, and of course, specific training offer is dedicated to delegates and focal points, which are, of course, part of our target audience. So in few words, this is how the capacity building system works at the OIE to support members through the PVS and the training platform. And with this combined access, to these resources, we expect, we hope that our members will work to implement more competent, more adequate, more robust workforce. But if you now want to learn more about the workforce assessment and development, you will now have to follow the presentation that our colleague David Sherman is ready to provide us with. David, the floor is yours, and thank you for your attention. The microphone, David.
Sorry.
Thanks.
Morning, everybody. Let me share my screen. Okay. So as Barbara pointed out, I'm going to talk to you this morning about workforce assessment planning and development. It's a pleasure to be here. So the content of the presentation is I'll start with some definitions on what is workforce development and why is it important, and then why OIE is interested in workforce development. Oops, sorry. Steps in workforce planning and what the challenges are to effective integration of veterinary paraprofessionals into the veterinary workforce and how they can be addressed. So what's workforce development and why is it important? Well, some very simple definitions. Work is the jobs that need to be done. Force is the people to do those jobs. So workforce is having the sufficient numbers of personnel with the appropriate skills needed to perform all the jobs and tasks that are required within the defined context. And for us, the defined context is the veterinary domain. And if you ask then what is workforce planning? Well, the figure on the right gives an illustration of very simple terms what workforce planning is. And what it is finding the right people with the right skills putting them in the right place at the right time to deliver the services that are required at the right cost. Okay, so then how do we define the veterinary workforce? Well, there are many different ways we could approach that, but for the sake of this discussion, I'd like to frame it in the context of looking at public and private sector functions. So public and private good functions in the veterinary workforce. Traditionally, OIE has been primarily concerned with so-called public good functions, which are defined as goods or services that primarily benefit the public at large. And we know what these are: the animal disease surveillance, control, and eradication of transboundary animal diseases, certification, veterinary public health, such as zoonotic disease control and food safety. And the OIE has been less focused traditionally on so-called private good functions, which are defined as goods or services that mainly benefit the individual who receives them. This is largely clinical practice. So clinical animal health services provided to farmers and herders for their animals, and herd health and production services such as AI, pregnancy checks, and so forth. But the two realms should not be thought of as being mutually exclusive. Okay. In fact, we should recognize that there's often a continuum of engagement across public and private sector responsibilities in the veterinary workforce. And the objective of workforce planning should be on achieving an optimal distribution of responsibilities in the public and private sector based on the human and financial resources that are available in the country to develop and maintain and sustain the required workforce. And in planning, we have to recognize that there are differences between who leads or manages an activity, who funds the activity, and who actually provides the service of that activity. So 3 examples: an activity can be publicly led, meaning managed by the government, funded by the government, and provided by the government, which is usually the case for most national disease control programs. However, activity can be managed by the government or publicly led and funded by the government, but it can be provided privately through government contracts or sanitary mandates. Thirdly, an activity such as clinical practice can be privately managed, privately funded, and privately provided by private clinical practitioners whose clients pay for their services. So these are just 3 examples in a range or continuum of engagement. And here's just 3 examples to illustrate the point. On the left, we have a picture of vaccination activities for small ruminants for PPR control in Abu Dhabi. And this control of PPR is a public good function, and it's most likely conducted by government personnel, but it could be supported by private vets and veterinary paraprofessionals through sanitary mandates or contracts. In the middle, we have a picture of a veterinary paraprofessional who's in private practice at the district level, vaccinating chickens for Newcastle disease in rural Afghanistan. And the question is this a public or a private good? Well, it could be either. I mean, if the country has a national disease control program for Newcastle disease, then these vaccinations might be carried out as a public service by the government. If there is no national program, individual poultry owners may still want to protect their birds, so they may be willing and able to pay for this service in the private sector. But either way, in remote areas that are underserved, VPP activities could be supported by government in those areas by improving access to animal care through veterinary paraprofessionals. Finally, on the right, we have a picture of a small ruminant abattoir in Zimbabwe. And again, meat inspection is generally recognized as a public good function, but it could be contracted to veterinarians in the private sector, and but still be managed by the government veterinary service. So why is OIE interested in veterinary workforce development? Well, I mean, the veterinary workforce is an essential component to the effective functioning of the national veterinary services. And the Terrestrial Animal Health Code in Chapter 3.2 on veterinary services focuses on workforce. And Article 3.2.5 points out that both veterinarians and veterinary paraprofessionals are an essential component of the veterinary service, and also points out whether they are in part of the government authority or as private sector providers, private service providers. So we have vets and VPPs, and we have the public and private sector, all contribute to the national veterinary workforce. And Article 3.2.4 says that veterinary services should be appropriately staffed, including vets and VPPs and other personnel with appropriate competencies obtained through initial and continuing education to allow their functions to be undertaken effectively and efficiently. So if we want to do workforce planning to achieve that happening, I'll go back to what I told you before. And if you look at the previous bullet, basically what OIE is saying is that veterinary services should be appropriately staffed, including the right people with the right skills obtained through initial and continuing education to allow their functions to be undertaken at the right place and right time and at the right cost. Okay, so that's workforce planning. And again, to emphasize the importance of workforce to vet service in the PVS tool, the first two critical competencies address staffing. The first identifies staffing numbers for both vets and VPPs, and the second competency looks at the competency and education of vets and VPPs. And interestingly, during the early phase or early years of the PVS program, it was alarming to discover that quite often in a number of countries, the assessment scores for these two competencies were actually low. And there were particular concern about the competency and training of veterinarians and VPPs. And as a result, OIE developed the Day 1 competencies and curricular guidelines for veterinarians back in 2012 and 2013. And more recently, did the same thing for veterinary paraprofessionals, 2018, 2019. And now in the latest version of the Terrestrial Animal Health Code, Article 3.2.5 specifically encourages vet services and veterinary statutory bodies to use these guidelines to ensure that training programs provide the required competencies for both vets and VPPs. So summing up then, what is the OIE perspective on workforce and workforce planning? Well, OIE believes that sufficient numbers of adequately trained personnel are essential for the proper functioning of a national veterinary service, and that a broad range of service providers can participate, including vets and many different categories of VPPs and other personnel, but all of them must operate within the framework of the law and be properly trained, regulated, and supervised to perform the tasks that they are permitted by law to do. And veterinary workforce planning then is the process to help ensure that the nation has the right number and mix of vet service providers in the right places to reliably provide required veterinary services at acceptable and sustainable costs. So to do that, what are the steps then in workforce planning? Well, I mean, there are many different approaches, but this is sort of a schematic to sort of give an overview of the steps that are likely to be involved. And the first, of course, is what actually exists at the moment. So we need to define the size, composition, and distribution of the existing workforce. And having access to reliable data is critical in this regard. You need to know the actual numbers of vets in the field, both in the public and private sector. You need to know the numbers of animals by species and their distribution in the country at the different administrative levels within the country. And then you can characterize the existing workforce. Once that's done, you can then begin to identify gaps in provisions of public and private sector goods and service, again, with the use of reliable data.
David,
Then,
David,
yes.
Talking very speedily, the interpreters cannot follow.
Okay, I'll try. Well, I'm in the interest of time, I'm trying to move ahead, but I'll slow down. Thank you. So then the third step is to calculate the numbers of personnel required by sector, function, and location. The fourth step then would be to, once the gaps are identified, need to characterize the kinds of people who can fill those gaps. Are the skills required sophisticated enough that it needs to be graduate veterinarians? Would the skills serve the capacities and training of veterinary paraprofessionals, or perhaps even vaccinators who are trained for short periods of time, but are only needed in the workforce on a seasonal basis to carry out vaccination campaigns, just as an example. So with that in mind, then you develop job descriptions and competency skill levels for those workers. Based on that, you would then plan solutions that bring demand into line with the need, meaning is it affordable? And for example, will vets work in an area where vets are needed, or is there insufficient demand or income potential for vets to have an incentive to work there, in which case maybe VPPs would be the answer. Then once you've determined that, for example, if you decide that VPPs are an essential element, then you need to be sure that the policies and the enabling environment are in place that allow VPPs to work. So in other words, your solutions can be implemented through a proper enabling environment. If I go back then to number 5 on the question of need and demand, I'd like to just say a little bit more about that. To clarify it, is that oftentimes workforce assessment studies confuse need and demand. In my own country, in the USA, for example, for many years now, there's been a clear and persistent need identified for more food animal or livestock veterinarians in specific underserved areas of the country. However, despite this need, there's insufficient demand in some of those areas to make veterinary practice financially viable. So vets do not go into private practice in those areas despite the need. And of course, this is true in many other countries as well. It may likely be true in your countries as well. So what are some possible solutions? Well, in the US, for example, where veterinary education is very expensive, government incentives can be given to lure practitioners into those areas, for example, forgiving student debt or student loans. Or there may be opportunities to supplement income of private practice through sanitary mandates or public service contracts to deliver activities on behalf of government, like brucellosis vaccination, for example. Or thirdly, it may be to establish and support policies that allow veterinary paraprofessionals to provide services in those underserved areas where veterinarians are not willing to go. Okay, and I'd like to give you an example of a workforce assessment and planning activity that occurred in the United States. This happens to be in one individual state, the state of Kentucky. If you look in the upper right corner, you can see where it is in red. It's on the eastern part of the country, in the east central region, and the Appalachian Mountains move from north to south through this particular state of Kentucky, so that the mountainous area is on the right-hand side, which is circled, and the plains or the agricultural plains are on the left-hand side. And just for perspective, this state of Kentucky is about 20% larger than the country of Jordan. So just to give you an idea of how big it is. Okay. So what the state, of a university with a veterinary school in the region decided to do workforce planning activity, and they collected the data in this state, and there's very good data available. So they were able, oh, also I just want to say that this state, in the United States, we call it a state, and the subdivisions are referred to as counties. You might think of them as a province of a country with districts within that. So state, county, equivalent to province and district. So all the districts or counties are demarcated in the state, and the data is available, very good data is available at the county level. So the evaluators, the assessors here, they calculated the livestock populations of each county by every species of livestock. So they knew exactly how many animals were available of livestock by each species in each county. Through the veterinary board in the state, they knew exactly the numbers of veterinarians. They were able to calculate proportions of veterinarians to animals present. Then they calculated the kinds of activities and the amount of work that was required to serve the regular routine needs of the livestock in those counties. And on that basis, they made a calculation of a full-time equivalent, means a veterinarian working 40 hours a week to provide the services that are necessary. And based on those calculations, they then produced this map, which projects the number of veterinarians needed over the next decade. And interestingly, the data that they collected from the statutory body, or the veterinary board, included the ages of the veterinarians. So they actually knew how many or what proportion of the veterinarians were over 60, and calculated in determining the future need, the rate of retirement of veterinarians in the region. So with all that background, what I want to show you now is that if you look at the box on the left, it shows the number of full-time equivalents or veterinarians that will be needed in the immediate and near future. And if it's 0 to 2.5 vets, it's in beige. If it's 2.5 to 13, then it's a little darker, and then the red is 13 to 25. And what I want to point, and you can see that there's projected needs in all of those ranges. But if you look in the mountainous area on the right, you see that most of those counties need veterinary services, but they need less than one veterinarian. And I've highlighted 3 adjacent counties there. One needs 0.7 full-time equivalent, one needs 0.2, and one needs 0.1. So those 3 counties combined need 1 veterinarian. But to put 1 veterinarian there is not practical, because these are mountainous region, hard to travel, long distances, and 1 veterinarian cannot cover that region. So now we have a lot of useful information, very specific information. We can start to do very specific planning. And we can say that, we can't ignore the livestock holders in these counties because they need less than 1 veterinarian, because an absence of a veterinary personnel is not an option, because the livestock owners need service, and the state veterinary authority needs a presence of educated, trained people for reporting and surveillance purposes. So how can these personnel gaps be filled? And what I want to underscore is that this kind of detailed assessment with mapping really gives you a lot of useful information to start to begin to develop solutions. So for example, in those 3 counties that I've highlighted, what might be a consideration? Well, we could put 1 vet in each county and have the government subsidize their salary, basically make them government veterinarians. Or perhaps, if the enabling environment permitted it, we could put a VPP in each of those counties with 1 veterinarian supervising them, so that there's a local presence of a VPP, but they report and get guidance from a single veterinarian. But for that to happen, the law and the regulations in the state have to allow that to happen. So I hope that this is illustrative of the kinds of usefulness and challenges of workforce assessment and planning. So what are those challenges? Well, globally, not just Kentucky, but globally, we have issues like recognized categories of VPPs are not well defined, and VPPs of different levels of training sometimes have the same job title in different countries. So an animal health assistant may be trained for 1 year in one country and 4 years in another country. So they really have different skill levels and experience. So they need to be categorized more accurately. The prerogatives of different categories of VPPs may not be clearly defined. So it's not clear what it is they're trained to do or what they're expected to do. Their education varies greatly in duration, content, and quality. And they may perform activities, this is a frequent complaint, they may perform activities for which they are not properly trained, or the statutory body does not approve. And even though there may be or may not be supervisory relationships, and even if they're there, they may not be properly observed. As a result of all these relative deficiencies, VPPs are often viewed by veterinarians as competitors or problems, and not as collaborators. And therefore, there's resistance to builds to formal acceptance of VPPs. So it's really essential that VPPs, if they're going to be effective, they need to be properly recognized, and they need to be regulated in a framework that gives them some legal footing and ensures their competence. So we have to ask ourselves then, in any country, in terms of the enabling environment, is there a legal basis for VPPs to work in the desired context? In other words, is there a legal mechanism for VPPs to work in private practice? Okay. Is there a statutory body? And if there is, does it identify and regulate suitable categories of VPPs? Are there sufficient training institutions delivering training of quality to produce VPPs with the needed skill sets? And are there conditions or opportunities that can be exploited that will help veterinarians to embrace VPPs as team members in veterinary service delivery and not see them as competitors? So as Barbara pointed out, we have within the PVS pathway, and particularly into targeted support, a number of ways that we can help you as delegates to do assessment and planning of workforce, and to create the enabling environment for VPPs to work when your workforce assessment and planning identifies or indicates that the integration of VPPs into your workforce can in fact be a useful solution to your workforce needs. So as Barbara said, the gap analysis has a component for calculating workforce needs to deliver the public good services within the veterinary service. And we're developing new tools which will provide that same sort of power to better analyze the needs in the private sector, and hopefully to include mapping capabilities so you can visualize the needs like I showed you in the map of Kentucky. And then in regard to the enabling environment, we've got the legislation support program, which can review the legislation to look at your country laws around regulation of the profession and help you through the VLSP agreement to draft new legislation or practice acts that provide adequate and clear coverage of VPPs. Similarly, for regulation, we have the VSB twinning program that can pair you with a country with a well-functioning existing VSB to help establish and operationalize a VSB in your country according to the legislation that's been developed. And we're now in developing VSB planning missions. So rather than having to identify a parent country to team with, we are developing a list of VSB experts who can go on missions and work with you directly to work on the development of the VSB. And then, as you know, in the area of education, we already have the veterinary education establishment twinning programs to strengthen curriculum and competencies for veterinarians. And we are developing educational missions for curriculum review and curriculum development for VPPs using the new curriculum and competency guidelines. So finally, in conclusion, an effective veterinary service requires an adequate number of properly trained personnel of different categories and skill levels. Systemic workforce assessment can identify gaps in the numbers and categories of personnel required. And challenges to workforce development exist, notably a lack of access to critical data and the absence of a supporting regulatory environment. Veterinary paraprofessionals can play an important role in filling identified gaps, but they must be properly trained and regulated, their responsibilities clearly defined, and their work supervised and monitored. And OIE can assist members in workforce assessment and planning and in creating an enabling environment for effective integration of VPPs into the veterinary workforce. So thank you for your attention.
Thank you very much, David, for this extensive presentation. Allow me to say that we would like to encourage the participants to put comments and questions in the chat. And a second information, which is important to know, is that for any interest you may have in this kind of support, of course, delegates can directly interact with our regional and sub-regional offices, and we are available to discuss country needs through these offices. The floor now goes very quickly to Jennifer Lasley. David, maybe you should stop sharing your screen.
I have to stop sharing my screen. Yes, thank you.
Thanks.
Hello, everybody. Thank you very much for the opportunity to speak with you briefly about the Global Laboratory Leadership Program. So the Global Laboratory Leadership Program, or the GLLP, is a program that will help to support the workforce and competency development of the veterinary services that both Barbara and David have
Jennifer,
referred to today.
Jennifer,
yes.
Excuse me, maybe you should invert your display settings. Thanks.
Thank you very much. It's for now. So, thank you. So the GLLP partnership, some of you may have heard of this, this initiative so far. This is a multi-sectoral collaboration of 6 organizations working with laboratories to build, working with laboratories with a public health impact. So this can be animal health laboratories, environmental health laboratories, clinical human health laboratories, hospital laboratories, public health laboratories, etc. To foster and mentor laboratory leaders, to build, strengthen, and sustain national laboratory systems. And so the founding partners of the Global Laboratory Leadership Program are the Association of Public Health Laboratories, the Centers for Disease Control and Prevention, the European Center for Disease Prevention and Control, the FAO, the World Organization for Animal Health, and the WHO. So you can see here we have a mix of major animal health and human health organizations specializing in laboratory strengthening. And so together with these 6 partners, so OIE and these 5 other partners, we have developed the Laboratory Leadership Competency Framework that outlines the essential competencies needed by laboratory leaders to build and direct sustainable national laboratory systems for disease detection, control, and prevention in health systems. And so we're taking a strong multi-sectoral and One Health approach and addressing the national health laboratory system, which is composed of human health laboratories, animal health laboratories, and environmental health laboratories. So really promoting that One Health approach there. This document right now was provided to you in the documents that were provided for the commission meeting. And if you go to the GLLP website, you will find that it's also available in English, French, Russian, and Spanish. And I think in Arabic, it will be coming soon. So we can follow up with that aspect as well. In the competency framework, there are 9 different competencies that are outlined: laboratory systems, leadership, management, communication, quality management systems, biosafety and biosecurity, disease surveillance and outbreak investigation, emergency preparedness, response and recovery, and research. The learning package, which constitutes the curriculum that has been developed for this program, is flexible and can be adapted to a country's or regions or subregions needs. The learning package provides materials for implementation. So you have within the toolbox, there's a planning and implementation guide, a mentorship guide, and virtual and in-person course materials for 43 different modules across laboratory management, leadership, and systems units. And they're composed of PowerPoint presentations and instructor and participants guides. So you have a very full curriculum with lots of materials to be able to strengthen the capacity of laboratory management in member countries. And a preliminary version of the learning package is ready now for testing and piloting, and is in fact underway in 11 different countries around the world right now. And there is one country in which this is already starting to develop in the Middle East. But the veterinary services has yet to be engaged. And so this is an important thing that we'll talk about in terms of risks coming up. The training program is developed of content that can last up between 18 and 24 months through interactive didactic sessions and practical mentored laboratory experience and small projects between the sessions that support the learning occurring during sessions. There's a mentorship component over the 2-year program at regular intervals, and that can be developed through in-person or relationships such as twinning. There are projects to support learning and needs of the country. So those small projects that would be completed in the first 18 months, and then a capstone project during the last 6 months. And so some of the projects that we've already heard about are integration of laboratory strategic planning into the One Health steering committee or working group at the national level. There's also a strong community building and community of practice building activity over the 24 months, but also of course beyond, so between cohorts and across cohorts over time. Trying to build that network and attain a critical mass of workforce working together in a multi-sectoral way in countries and regions around the world. And so to date, there's been heavy multi-sectoral engagement from both the human health and animal health expert side. We're still looking for engagement on the environmental health side. And so with all of the different priorities that exist in the integration of and the realization of the One Health approach with environmental health expertise, we're still looking to engage that and get laboratory strengthening on the list of priorities for environmental health engagement. So in terms of contributions to this curriculum that's been developed across the 9 different modules, or the 9 different competencies. 140 reviewers across the 6 partners have participated in the review. So we can see nearly equivalent levels of human health and animal health expertise. And we hope that we'll be able to gain additional environmental health expertise to round out the curriculum. There are references across the sectors throughout the curriculum as well. We've taken great pains to ensure that the OIE and FAO reference documents, guidance documents, of course, the OIE international standards, regulations, operations protocols, SOPs, toolkits, any tools that are available across the sector for laboratory capacity building. We've made sure that those references are there, as well as One Health activities that the OIE is working on, like national bridging workshops, the tripartite zoonoses guide, the operational tools, and the joint risk assessments. All of those things are worked into the curriculum as well to ensure that this activity is in its proper big picture context. So now, as David mentioned earlier, the OIE now has competency guidelines for veterinary paraprofessionals and curricula as well. And there is, within those documents, there is a laboratory track for the veterinary paraprofessionals. And so that means that laboratory technicians, assistants, technologists working within the laboratory sector have competency and curricula guidelines already available. And now with the engagement of the OIE in the Global Laboratory Leadership Program, the laboratory leaders, so directors, managers, department heads, scientists, researchers, all have access to a competency framework that's been completed, as well as the curriculum or the learning package materials that are available to them. So all the technical veterinary laboratory staff in any country now have access to those competency and curricula guidelines. And as Barbara mentioned with the OIE training program, all of this material is being mapped across the OIE training program and the training portal and the different competency packages that Barbara mentioned earlier, and the laboratory competencies, because of the importance of laboratories across the veterinary domain, while of course the laboratory services is critically important competency, there are also other laboratory competencies that can be mapped across the different competencies. And so we will be engaging in that work in the future. In terms of the OIE's target outcomes for its involvement in the Global Laboratory Leadership Program, our goals are to ensure that veterinary laboratory participants, so leaders and managers in veterinary laboratories in our members, participate in every national, regional, sub-regional program of the Global Laboratory Leadership Program. Right now, the funding that is available for Global Laboratory Leadership Programs is really being driven on the human health side. So you have lots of donor money coming from DITRA, from USCDC, from the Global Fund. And so there are lots of those pilots that are being driven from those sources of funding. And we've seen that there have been challenges to engage and ensure that the veterinary services or the Ministry of Agriculture are involved as early as possible in the planning and implementation process. And so this is a big target for the OIE to ensure that through our regional representations, that we can really engage with you as much as possible, provide the information you need, provide the contacts in the case of programs occurring within your countries, to ensure that the veterinary laboratory leaders can participate and benefit from the capacity building programs and be a part of this One Health program. We also are targeting, in terms of outcomes, that existing One Health platforms and mechanisms are leveraged to add GLLP to their work plans. So thinking about those high-level One Health, sometimes ministerial or technical working groups that exist in many countries, that the Global Laboratory Leadership Program would be integrated there, because those programs and projects at the country level will certainly contribute to the goals of those One Health platforms and mechanisms. Another outcome that we are targeting is that we support the development of the cohorts of lab leaders and really trying to promote and build a One Health community of practice in the laboratory sector, but also in the larger health system. and the workforce development of laboratory leaders contributes to the sustainability of the laboratory systems. Most of the challenges that we encounter in the PVS Sustainable Laboratories missions are related to core leadership and management skills. And so the reinforcement of those competencies and skills through the workforce development will reinforce those laboratory systems. So those laboratories or those laboratory leaders can create and foster a culture of safety, security, quality, and scientific excellence in veterinary labs globally. So the OIE engagement with our members is really important to us, as mentioned previously, and we can support the veterinary services and the veterinary laboratory engagement in the global laboratory leadership programs that may be occurring in your countries or regions. So our regional representations can facilitate that engagement with the delegate and the laboratory focal point for each country program. And we also can provide institutional support with the GLLP partners to make connections, communication, and access easier. And also host regional and bilateral meetings to brief the authorities on the GLLP and encourage your engagement and benefit for your laboratory leaders. Thank you very much for your time.
Thanks a lot, Jennifer. Let me underline that this program has developed a huge quantity of training material for laboratory leaders, and I want to encourage you to go and have a look because there is really a huge quantity and qualitative materials to be used, and it's very important to have them available. Sonia, you have 5 minutes to run the poll and to ask the questions we want to offer our guests today. So the floor is yours. Hurry.
Thank you. Thank you to the speakers and thank you to all participants. We're eager to hear your thoughts on prioritizing different elements of these developing programs. So I'd like to invite my colleagues from RAD to put the poll on the screen. And we would first like to ask you if you could select the priority competency packages that Barbara described earlier that would most suit the learning needs of your national veterinary services. As Barbara explained, we have a huge amount of work that's developing over the next few years. And one of our tasks is to prioritize which elements to offer first based on the needs of our members. So you can see these 8 competency packages first that Barbara highlighted. So please click on 3. That's in the first question. And in the second question, please also select 3 priorities. And this will help give us an idea of some of the priorities in terms of learning needs, capacity building, and continued professional development from your national veterinary services and perhaps partners or other stakeholders as well. So to use the poll, you need to just, it should come up on all of your screens, and we invite participants and delegates to identify 3 competency packages from question 1 and 3 from question 2. And we'll just have a couple of minutes to do that. This will allow us to get a global picture of some of the emerging needs from members and help us identify if there are particular priorities where we need to invest more urgently in developing training online.
Excuse me, Sonia, I'm trying to submit, but I don't know, it's not working. I select, but it can't be submit. I don't know if the other colleagues have the same problem.
Thank you.
May I explain? The problem is that you have to answer both questions. So there is part 1 and part 2. If you answer part 2, then you can submit. Try.
You have to scroll down to see part 2.
Yes.
Okay. I see there are some answers, so someone succeeded. So you see that in the first part of the question, there are the first 8 competency packages, and in the second part, the other 8 competency packages. You have to select maximum 3 each, and when we will see the results of all the people, we will see which are the priority competency packages for the region. So we invite you to submit these answers if you can.
So we'll just give another 10 seconds or so to finalize the selection. And if you have other comments on the discussions or any more detailed requests, you can also put those in the Zoom chat. So please, if you could complete your responses. Natalie, how many do we have now?
I think we have almost all the delegates and part of the participants that answer. So maybe we can stop the poll if you want, Sonia.
Okay, just another 3 seconds for anybody who wants to give a final submission. And then if you could please share the results with us, that would be great.
Sure.
Okay, so we see that there are some priorities that have emerged. It seems like training on the OIE is less of a priority. You probably have many other ways to learn about the OIE. Quality and management of veterinary services and aquatics, risk analysis, laboratory services are all quite important. Animal health management comes out as less of an urgent priority, but emergency management is quite high. And prudent use of antimicrobials and other veterinary products is also fairly low. So it will be interesting. We have following this session on AMR. So maybe some issues will emerge in that discussion. And in the second set of topics, emerging risks, fairly high. One Health is extremely high. Food safety, socio-economics of animal health. So I think this is giving us quite an interesting picture of what some of the priorities are regarding emergency management, management of veterinary services, and One Health as being really the top expressions of interest for now. So that will, we will certainly consider that. And I will pass the floor now to Dr. Barbara Alessandrini and Dr. Fajr Al-Saloom to provide some comments.
Thank you very much, Sonia. And thank you also to the President of the Regional Commission for Middle East to sharing this last session with me. So Dr. Al-Saloom, as this poll has evidenced, there is a block of priority that has emerged. So risk analysis, emergency management, emerging risks, laboratories, and One Health, which is your overview on this selection that the delegates and the other participants have prioritized.
Yeah, thank you, Barbara. I think in my perspective, idea about the priority in our region that we work before on it is the first One Health to be engaged more in the system, and also the maybe I will talk about something, maybe it's not mentioned here, which we find it's not being covered for the workforce, which is related to the economic and the climate changes. So these kind of, I think, matters or issue is not even being learned or educated in the university or any other faculty that it can cover or define these issue, which is interval with the veterinary service. So it should be like have a balance now. Today, the veterinary have another challenges in the field regarding to the economy and the climate changes. And also, it's been good identify about the workforce, the 5 right that David mentioned, right people, right skills, right training, right cost. It is very important to cover all these things. Any strategy that we'd like to implement it for the different project, we have to have these 5 first, and people in qualification, in planning, in legislation, in all these things.
Thank you very much. Thanks a lot. And I mean, what you said is really something very interesting and important, because you provided a true One Health approach. And once again, let me say that people working in veterinary services have this concept very well established in mind, and also something that is very, very much in the breaking news, considering that in these days we have the COP26 being running in Glasgow. So definitely this is something we are oriented to work on, and together with the other organizations, WHO, FAO, and also UNEP, the new global plan of action will incorporate and include these perspectives. So thank you for highlighting such an interesting and important perspective. And thank you all for following this session. Maybe Dr. Eloua, would you like to provide few final remarks about this session?
Yes, thank you, Barbara. Thank you, Barbara. And firstly, I would like to congratulate you, David, and Jennifer, for your very clear and comprehensive presentation that was really splendidly made. Thank you for that. And thanks to that, I do believe that all the delegates now can understand what is our program with regard to training, with support for capacity building. And let me just remind one additional sentence from the G20 leaders declaration. They said that the G20 leaders reaffirm the importance of strengthening national health system through enhanced health curricula and training materials. And of course, veterinary services and laboratories are component of health system. And therefore, that is from our point of view, the conclusion of all the discussion we had this morning. Thank you.
Thank you very much, Dr. Eloua. So this session is concluded and the floor goes back to Natalie. Thank you very much for your attention.
Thank you very much, Barbara, and all the speakers for this very interesting and informative session. And thank you for respecting the time. I know it's difficult, especially when there is such a huge amount of interesting information you want to communicate to participants. And I will now give the floor for the last technical topic in the agenda to Dr. Christoboulos Pipis, the delegate of Cyprus and the chair of this session. Dr. Pipis, please. Dr. Pipis. I don't know if... I think you are mute. You are mute, sorry. But now you are not mute, but we can hear you. No, Dr. Pipis, there are some problems with the sound. No, I'm sorry.
Sometimes it helps to disconnect from the Zoom call and reconnect.
Okay, I'm sorry for that.
Dr. Pip,
Okay.
I propose, Natalie, that
we
continue and
yes.
that Rebecca
yes.
could start her presentation.
Yes, I'm sorry for that. So we will pass with the to the AMR session. And for this, I will give the floor to Dr. Rebecca Hibar from the Antimicrobial Resistance and Veterinary Products Department, who will present on the tripartite activities on AMR. Rebecca, the floor is yours.
Great, thank you, Natalie. Can you all hear me?
Yeah, perfectly.
Great, wonderful. I will just put my presentation up. And this should be in full screen, is that the case?
Not yet. No, it's fine.
Perfect, thank you. So good morning, everyone. It's a pleasure to be here. Just to briefly introduce myself, I'm Dr. Rebecca Hibbard. I'm a project officer in the Antimicrobial Resistance and Veterinary Products Department. I'm presenting on behalf of Dr. Olafur Valsen, who many of you may know is the deputy head for the AMR and Veterinary Products Department, and also the tripartite liaison officer for the OIE. I work with Olafur on the tripartite joint secretariat for AMR. So we came up with 4 main topics that we thought would be interesting to provide you with an update for the current tripartite activities on AMR. So these are an update on the global governance structures, the tripartite strategic framework on AMR, the multi-partner trust fund on AMR, and then very briefly on the One Health Global Plan of Action. So to begin with the global governance structures, these structures were recommended to be established by the Interagency Coordination Group on Antimicrobial Resistance, and the Global Leaders Group is the first of these structures to have been established in 2019. The role of this group is to provide advocacy and advisory functions to ensure that action is taken to address the challenge of AMR. And this group includes members of the 3 organizations, civil society, and the private sector. It is co-chaired by the Prime Minister of Bangladesh and the Prime Minister of Barbados. And you can see that the Directors General of the 3 organizations, as well as the Executive Director of UNEP, are ex officio members on this group. You'll see that there have been some statements and information notes prepared recently. From the titles of these, which we've included, you'll see that there's been a focus on animal health and production and use of antimicrobials in those sectors, as well as financing the response to AMR, highlighting the lack of funding in the animal health sector. And there's also a recognition of the need to better understand the role that the environment plays in the development of AMR. And currently the GLG is working on key performance indicators for their actions. The second of the groups that we'd like to update you on is the multi-stakeholder partnership platform on action against AMR. Now, this proposed platform aims to bring together different voices across the human, animal, plant, and environmental interface in a One Health approach, and to serve as an inclusive international platform by playing a catalytic role at global, regional, and country level to implement the Global Action Plan on AMR. We'd like to particularly highlight that there's been an online survey that was recently conducted by the tripartite to collect feedback from a broad range of stakeholders about this platform. And the responses were very encouraging because there were over 670 responses. These were across a range of different sectors, and the animal health sector was very well represented. And over 93% of these were overall positive about the way the platform had been structured. And if it's of interest to see in more detail, the results of this survey are going to be published publicly, so you'll be able to view these at a later stage. The launch of this platform is currently planned for early 2022, pending confirmation of financing. We would also like to update you on the strategic framework on AMR, and this is a document that's being prepared to highlight the joint work of the tripartite to advance a One Health response to AMR. And there are really 3 key components to this document: is to present the background and the context for the collaboration between the tripartite organizations themselves and tripartite and UNEP, highlighting the comparative advantage and the catalytic role of the AMR in presenting into tripartite in having a One Health response to AMR. And it also includes a theory of change for 2022 to 2026. And for those of you that are perhaps not so familiar with a theory of change, this is really a structure to identify the causal pathway from the inputs and planned activities of a project through to how we're going to get to the outcomes and impact and identifying the mechanisms by which the results are achieved. There is a 2-year work plan that's going to be associated with the strategic framework. So it's being drafted for 2022 to 2023, and this will be updated every 2 years. The launch is currently foreseen for either the end of this year or the start of next year, and there has been engagement of UNEP with the development of this document. Now, on the next slide, this will be rather busy because this just show you very briefly what the theory of change looks like, to show that the overall goal of the strategic framework that we're highlighting is to preserve antimicrobial efficacy and ensure sustainable and equitable access to antimicrobials for responsible and prudent use in human, animal, and plant health, contributing to achieving the Sustainable Development Goals. And what you'll see is that in order to get there, we have a number of steps engaged. So there's an outcome relating to policies and laws for One Health AMR responses, the systems and structures for the implementation of country-owned AMR responses, and for increase in sustainable resourcing. Once you move down to the green part of the diagram, you'll see that there's an output related really to country capacity building for implementing One Health work to control AMR. There's another output relating to regional and global initiatives. So this includes items like the Multi-Partner Trust Fund, which I'll speak about next, the work of the Tripartite Joint Secretariat and advocacy on AMR, and the global governance structures, which we already touched on. And that there's a very close link with the Global Action Plan on AMR, because the pillars of this are identified down the bottom, and these are really integrated into the document all the way through. The next item to present is the Multi-Partner Trust Fund on AMR. Now, this is a mechanism to secure consistent and coordinated development financing, which will support One Health National Action Plans, AMR, and tripartite work plans. This was set up for an initial 5-year period, and there's been consideration for the way forward, which is to extend the Multi-Partner Trust Fund to 2030, consider a no-cost extension of the existing projects. There will be increased participation of UNEP in country proposals where relevant, and a broadening of resourcing. The Multi-Partner Trust Fund has a number of country projects and global projects. So the global projects that are underway at the moment, there are 4. The first one is TISA, which stands for the Tripartite Integrated Surveillance System on AMR and AMU. And this is designed to be a platform to display data from the 3 organizations on AMR and AMU at a global level. There's a monitoring and evaluation project for which OIE is the lead. And one aspect of this is develop direct technical assistance to countries to strengthen the monitoring and evaluation of their national action plans on AMR. Another project on legislation and regulatory frameworks is designed to develop and pilot a tripartite tool, which will assess AMR relevant legislation. And this is related to the OIE Veterinary Legislative Support Program, AMR questionnaire, which has already been developed. And lastly, there's an item, a global project on the environment. I will just highlight very briefly that there are 9 country projects which are currently being implemented. We don't have any country projects at the moment from countries in the Middle East, but there will be more country projects coming forward in the future. But just to show you that there are a range of different areas which are involved, activities across the different projects, and a sharing of who's leading each of the projects across the 3 organizations. The last item we wanted to mention very briefly is the One Health Global Plan of Action, which is being led by the One Health Tripartite Secretariat. And the reason we wanted to highlight this is because there are 5 action tracks. The last of these, number 5, is on antimicrobial resistance. And this is going to be very clearly linked to the strategic framework on AMR that I presented earlier. So just to give you an idea that this will be coming, it's in the very early stages, so that you're aware of this for the future. That's all I wanted to present today. I will just briefly mention also that World Antimicrobial Awareness Week is coming up very soon. It's the 18th to 24th of November, and there are usually a number of different activities planned for this, which you'll be able to keep an eye on. Thank you.
Thanks a lot. Do you hear me now?
Yes, Dr.
Yes.
Pipis. Sorry, we had to start the session due to time constraints.
That's not a problem, Natalie. Don't worry. It's okay for me. So thanks a lot, Rebecca, for the presentation. And I would like now to ask Dr. Gosche to give the next presentation.
Sorry, can you hear me?
Yes, we can hear
sorry,
you.
I had a technical issue for some seconds. Thank you very much, Dr. Pipis. Nice to have you and hear you now. Thank you for the introduction. And I'm also from the same department as Rebecca, from the Antimicrobial Resistance and Veterinary Products Department. And I'm mainly working on the antimicrobial use data collection, this global activity from OIE. What I would like to present very briefly, it's the work on the data collection from the region, but also at a global level, so you have a broader perspective. And then I will go to a tripartite activity. So this is a map that we have that is about the participation of countries all over the world from the countries. And this is, you can see that all countries in green are those that they have the participation from the countries, and those in gray are the ones that did not participate for the 5th round of data collection that was published in April this year. And we had around 160 countries participating. So thank you very much for all of this. And really, I will show them later, but the region of the Middle East increased their participation. So really, we are very proud of you for this. It was the first year where we have the greatest participation from the region. What I will present also, it's about the 7th round of the AMU data collection that started in September this year. And just as a reminder that the first deadline for submitting the antimicrobial quantities or the questionnaire is the 1st December 2021. So we have 1 month more to go ahead. But really, if you need more time, just contact the antimicrobial use team. All delegates should already received the invitation letter. But if you need more time, please don't hesitate to contact the antimicrobial use team. And then if for any reason you are wondering, or maybe the email, you have many emails and you are curious how the questionnaire looks like and might be difficult to find it in the emails, the questionnaire, the guidance for completing the questionnaire and the annex for the calculations are already available on the OIE website. So the links are here, and for sure you can take a look on them if you like to. Then I would also like to present, this is a very broad vision of what's about the participation on this global data collection. And really from the OIE, we're very proud of the countries, because you can see here in the light blue here, we have the total participation of countries. And then the dark blue here, it's about those countries that have the total participation providing antimicrobial quantities. So it's not only that the participation is increasing, but also those providing antimicrobial quantities. And then if we only focus here on the dark blue and we move here, because those are the ones that are providing the antimicrobial quantities, we will have here how countries are providing the quantities, because we have 3 types of data collection. The basic one is reporting option 1, which is the red one, then 2, which is the green, and then number 3, which is the most advanced, is the purple one. So you can see that all across the countries, they are moving gradually to reporting option 3, and the 6th and the 5th and the 6th rounds were the ones where for the first time reporting option is the most advanced, is the one that is the predilected by the countries. And then just a quick view on the Middle East. As I was saying, from the Middle East, during the 6th round is where we had most of the participation. So we are very pleased to that. And regarding the data collection, it's advancing. Mainly it's for reporting option 4, and a message that we would like to tell you is that the department has developed a tool for assisting the countries calculating kilograms of active ingredients. And that's how it was presented for the first time in the 5th round. It was presented to the Middle East at the beginning of this year. And if ever you would like to use that tool, please do not hesitate, because that's how many countries achieve very quickly reporting option 3. Then an update on the IT project. You know that we started with an Excel. That's how you receive the data for the questionnaire and how to submit it as well. But we are moving to an IT project that will be launched and presented more in depth next year. And our goal will be for the 8th round of the data collection. That means autumn 2022. You will receive updates during the next year, and we are also providing, we would like to pilot the system at some time in the future, so some of your ask, so we might come back to the countries to test the system. And finally, I will talk about TRACS, which is a tripartite activity on the AMR country self-assessment, the use of antimicrobial. Here, this is a different questionnaire that you receive, and it's a One Health approach, meaning that even if this is requesting AMR activities from the animal sector, it also covers environment, but in human sector. So it's expected that a country compiles all the information from the different sectors and provides one single reply. So what I would like to highlight here is that we have seen some inconsistencies, because there are some questions related to how you collect antimicrobial use data in your country, and this is provided to the tripartite. So we have seen some inconsistency between TRACS and the OIE. For your information, for the ones that we see the difference, we had 162 countries from TRACS, while there were 141 countries from the OIE. And from these 162 countries that we analyzed from TRACS globally, we saw that they were saying 101 replied data to the OIE, 8% were false, but then it gets increased for those that are saying that do not reply to the OIE. 80% of these responses were false because actually they provide data to the OIE, and 13 that were saying, I don't know what's going on. And that was an indicator for us that maybe the person that is replying for TRACS is not the right person, or does not have the knowledge of the animal sector. And basically, you have here the details of the responses, but the main message here is that if you take one of the responses from TRACS, you have the probability of 48% that the response will be false, either that they are providing the data to the OIE, and also the type of data that they were providing to the OIE. So this is just a suggestion that if ever you know that this is that your country is providing data to the tripartite, make sure that the animal sector is well represented. And just a very last, I will end with this, for specifically for the Middle East, the same approach, the same analysis is that for 12 countries that provided information to TRACS, it was 100% participation for TRACS, but then we had 42% of the responses related to the OIE data collection were false. So I will end just the information with that, and I will pass the floor back to Natalie. Thank you.
Thank you, Delphi. And before the interactive session, I will give the floor for a few minutes to our regional representative, Dr. Gassi Yehia, who will address a few words regarding AMR at regional level. Dr. Gassi, the floor is yours.
Yes, thank you, Natalie. Thank you, Pipis. Just a few words on an update from the Middle East region. As you know, we have in 2020, last year, and during the week of awareness of antimicrobial resistance, several meetings have been held in the region in several countries also, with considerable participation from the different sectors. For example, the one has been held in Egypt involved more than 500 people, including students and the stakeholders. This is also the reason why AMR is included as a topic, important topic in this conference. And with the aim is to, in the future, start formulate a regional strategy in line with the global theory of change. But the feedback from countries in the region demonstrated that in the previous years, there was less consideration for from the veterinary authorities to implement OIE standards and guidelines on IMR in national legislation. Accordingly, a potential link is set to the antimicrobial resistance multi-partner trust fund global program on legislation, which is developing tools for legislation development and review, and with the aim of combating the rising global threat on AMR through the One Health approach. Several, as I said, several activities has been conducted in the region to formulate national AMR surveillance. I selected one only, which is as a model. It is established in Jordan, which started in 2017 by establishing governance structure adopting One Health approach, AMR Steering Committee, National Coordinating Center, National Reference Laboratory, and the AMR focal point, building the national capacity in identifying emerging diseases, resistance, such as the cholesterol resistance, the establishment of national antimicrobial consumption surveillance, and implementing integrated AMR surveillance 3-cycle project in human, animal, and environment sector. We published on the regional website the tripartite strategy in English and in Arabic for interested people. Thank you very much.
Thank you, Dr. Gassi. And I will now give again the floor to Delphi and Rebecca for the interactive session for this topic. Delphi?
Yes.
The floor is yours.
Thank you very much, Natalie. Could you please confirm if you see the whole screen for the presentation?
Yes, perfectly.
Thank you. This is the time that we want to hear. We want to know what are your thoughts about AMR activities. So we will quickly start with one of the questions. What is the biggest challenge facing veterinary services to control the spread of AMR in your country? Please do not hesitate to use the chat. We want to know what are the challenges that your region, this region is facing, that your country is facing. So please do not hesitate. Just maybe as a comment for the AME data collection that help us since the beginning to know what were the challenges, so we can also take an approach or activities at the OIE. So please do not hesitate to write that on the chat. So we see one of them, it's about legislation. Thank you very much, Dr. Fajer. Do you think of something different? What's the biggest challenge for spreading the AMR? Is it legislation for all the countries? We see another one, antimicrobials are not being registered at the veterinary authority. Okay, so we see this is very punctual. So antimicrobials are not being registered at the veterinary authority. Could it be probably that is another agency, or that is antimicrobials are not registered in the country? Legislation and One Health concept. We have seen in other regions that sometimes veterinary products are registered by other ministry different than the Ministry of Livestock. Could it be the case for the Middle East? We see using antibiotics in animals without veterinary services monitoring. We also see, legislation again. No scientific data about the veterinary products that being resistant to build on that for registration. We see a reply back from Kuwait saying that this legislation that veterinary products are registered in the Ministry of Health. Lack of awareness on antimicrobial resistance. Well-tailored awareness programs. So maybe there is an awareness, but it's lacking probably for the stakeholders or needs to be boosted. Uncontrolled use of antibiotics, the illegal unauthorized veterinary products. Enforce legislation, behavior changes in the country. We see also our public awareness and education. Education is very important to work for the future veterinarians. The way the stakeholders conceive the need for using veterinary medicinal products and whether this is imperative to be used. So how the different stakeholders use the products, maybe we could refine if this we are talking about veterinarians or maybe pharmaceuticals, farmers, or maybe it's all of them. We also have one that is saying no going surveillance and detection of AMR, also no guidelines for antimicrobial use and awareness between animal health providers. There is no monitoring programs, no control antimicrobial use, lack of information on the threat of difficulty tracing, multi-sectoral collaboration, excessive use of antimicrobials, antibiotics, and lack of legislation, lack of laboratories as well. Farmers, I believe, wrong concepts of antimicrobial use, guidelines to use the antimicrobials and the withdrawal periods of them, lack of national expertise, no implementation of international standards. Really, thank you very much for all these questions, all these responses. I think we have a complete understanding of what's going on and need to strengthen, public-private partnership, conflict of interest for not respecting withdrawal periods. Okay, I thank you very much. Due to time, I will go to the next question. The next one is sorry, I will move here. Is what activity should the OIE prioritize to support the veterinary services to tackle the spread of AMR in the Middle East? Because first we talk about what were the main issues, but we want to know how the OIE can support you to tackle the spread of AMR. So please do not hesitate again to use the chat. We'll be very happy to know how the OIE can help you to help you with all the barriers that you describe, or maybe there are other things, or how you were expecting, or how you think the OIE can help you to control the spread of AMR in the Middle East. Training on inspection, I think it's one of them. Guidance. Would you please provide more information on which type of guide should we put our efforts? Awareness, communication, okay. Increase awareness and understanding on AMR and AMU, I believe. Training on AMR. Manuals for antibiotic use in animals. AMR should be included, we see here AMR should be included as one health concept in the region by enforcing an appropriate legislation. So we see again training, awareness for the public partnership, publications, development guidelines on AMR detection protocols for animal health and public sector. So we want here awareness for these sectors. We see also, is there a baseline data on a spread that can be used in proposing the projects? continuous studies and research. So we need to focus on that. Training, awareness. Awareness, I think, is, yeah, awareness. We have seen that due to awareness, you can achieve many things in the country. Setting of uniform basis and standards. List of antibiotics. Yeah, the OIE list of antimicrobials, which should not be used in a specific species. Yeah, the OIE has been working very lately in developing guidelines, the OIE list for animal species, awareness and published training. Okay, improving monitoring of antimicrobial use. So yeah, you need support on that as well, how to improve what you are already doing, developing the strengthened governments and political backstopping and support. Guidelines for use AMR, all relevant stakeholders and pre-graduated veterinarians. Guide for the use, the dose of antibiotics for some type of animals, for example, in camels, that's very specific for the region. And yeah, we need to to think about the needs of the region. Controlling animal diseases through vaccination training on level of biosecurity, animal farms, enhance One Health approach. Yes, alternative to antibiotics, that's for sure very important. Focus AMR in producing animals. Okay, yeah. So I think that's okay. Thank you very much for that. And for the next question, I will give the floor to Rebecca. Please, Rebecca, go ahead.
Thank you, Delphi. The next question is a Zoom poll. So this should appear on your screen very shortly. And this question is about which of the AMR related activities have the veterinary services in your country engaged in? And we're really interested to know not just if these exist, but really which ones are the veterinary services actively engaged in. So I'll read these out, but you can start to reply now, and you can pick multiple of the answers that are here, as many as you wish. So there's joint coordination and implementation of AMR related activities with other sectors, so humans and the environment specifically. Use of AMR and AMU data in animals to inform policy decisions. Development of national action plans to better control AMR and AMU in animals. Implementation of procedures to authorize veterinary products. And post-marketing surveillance for veterinary product quality. We're thinking of pharmacovigilance or either for substandard or falsified veterinary products. Natalie, perhaps you can let us know once we've received a sufficient number of responses.
Okay, sure, Rebecca. We're still in receiving responses.
Okay, great.
Maybe a few more seconds.
Okay. It's a chance to get any last minute responses in. You can reply as many as you like, remember, please. Perhaps 10 more seconds, and then Natalie, do you think we have sufficient number?
Yes, I think we can. Yeah, 5 more seconds and we can stop.
Great, so you should be able to see the results on your screen now. We can see that the first response seems to have a overwhelmingly positive. That was joint coordination and implementation of AMR related activities. So that's really good news to see that there's good intersectoral activities taking place. Also, the implementation of procedures to authorize veterinary products had a very high number of responses at 50%. I think the two that seem to have the least responses were use of AMR and AMU data in animals to inform policy decisions, and post-marketing surveillance. So please, if you want to add any further follow-up in the chat to explain why this might be the case, you're very welcome to. And then development of national action plans, we have 41% of respondents indicated that they were engaged in this. So overall, it's rather positive, but perhaps we can consider about AMU and AMR data and post-marketing surveillance for the future. The next question is related to the question we just answered, because we're going to ask you to please answer in the chat which of the which of the questions in the last Zoom poll, so I think the next Zoom poll has come up, yes, but this one is a chat question. Which of those options is the most challenging? And please also tell us why, so that we can better understand what are the difficulties that the veterinary services might face in engaging of each of these areas. So you don't have to write out the full line of each of them, but just to give an indication of which of these different options you think is the most challenging for the veterinary services to engage with. Please don't be shy, just go ahead and add to the chat. So we see I have one response for joint coordination from Turkey for the first option there. And if you can add any more reasons for why that's the case to help with our understanding, that would be very helpful for us as well. Perhaps because we had, I think, for the AMR and AMU data to inform policy in the post-marketing surveillance, this didn't seem to be very many countries engaged in this. Perhaps if we could have anyone provide why they think that's the case, what challenges they might face. Yes, so we see post-marketing surveillance seems to be coming up as a real challenge. And again, informing policy decisions with AMR and AMU data as well. Use of AMR in animals, again, so joint coordination and use of AMR and AMU data in animals. Also, once again, the first option relating to joint coordination and implementation. Difficulty to control the private sector as well has come up as another suggestion. Post-marketing surveillance again, development of national action plan to better control. Joint coordination. So we seem to be getting, yes, very similar responses between the participants. Once again, post-marketing surveillance, and this is because of its need for qualification and tools. So that's very helpful to know. And again, post-marketing surveillance as well. I think we'll give just maybe one more minute for any further responses, and then we can perhaps move on to the last question for this session. So last chance to add anything to the chat if you'd like to contribute. So we have having in mind the One Health concept for the first option, joint coordination, and also, yes, again, joint coordination as well as post-marketing surveillance. So it seems that the implementation of procedures has not been picked up. So that seems to be something that is, I guess, less challenging than all the other ones, but we've had some good feedback on why there might be challenges for coordination, post-marketing surveillance, and AMR and AMU data use and policy. So perhaps we can wrap up this question for here. Oh, we've got two more at the last moment. Post-marketing surveillance, because of the lack of easement in the field, development of national action plans, and post-marketing surveillance coordination. I think with that, we will wrap up this question, and I'll pass back to Delphi for the last question for this session.
Thank you very much, Rebecca. And the last question, it's a Zoom poll. So Natalie, I think it's in your hands. Yeah, thank you very much. So there is one question here. Which of the following actions to tackle the spread of AMR is most important in the Middle East? So here you can, it's only one single choice. So please think about it. We have involvement of the veterinary services in wider AMR management. We also have registration procedures for antimicrobials, legislation or regulations on antimicrobial use and antimicrobial resistance, promoting of AMR awareness campaigns among relevant stakeholders. And lastly, we have surveillance and monitoring of antimicrobial use and AMR. So think about it very well. That's the action. You need to think what's the action that is most important for your country. So that's very important for us to understand. And Natalie, just let me know how we are going, and if we are having some of the participation, or maybe countries are taking their time to think very carefully about this.
Countries are answering. We can just give you more seconds and should be okay.
Okay, great.
I think 5 seconds and we can close. Well, answers are coming, so. Okay. Here you have.
Thank you, Natalie. This is very interesting because we can see that I guess it's very different depending on the countries, but we can see that surveillance and monitoring of antimicrobial use and AMR is something that is the most predilected one, because it's different from the other ones that there were multiple options. Here is only one single choice. The next one is about legislation or regulation on antimicrobial use and AMR. Yeah, that's something that definitely you were saying that was most of that's the challenges. So for sure, it's one of the challenges that's important for you. You need to tackle this. And then we see promoting AMR awareness campaigns among relevant stakeholders. We saw many of these activities that you needed that the OIE does, but yeah, it's very important that you are saying you need to prioritize veterinary monitoring of AMU and AMR. We also have the late the one that was not most popular is involvement of the veterinary services in wider AMR management, because we already saw that you are very involved in a One Health approach for this. So maybe countries might need this, but for most of them, maybe not. So yeah, and legislation for sure. Well, thank you very much for all of this. Should I give the floor back to you, Natalie?
Thank you, Delphi. Before we go for a short break, I'm just looking at our Director General in case she wants to add something before we close this session. Dr. Eloa?
Yes, thank you very much. Of course, antimicrobial resistance is an additional important topic and challenge we have to address together. Let me also remind that now, in the perspective of the future treaty on pandemic, which could be decided at the coming extraordinary WHO assembly, antimicrobial resistance will be certainly a component of this international new legal instrument. Therefore, that is why I'm really proud that progressively more and more countries are well engaged in such a control program, and therefore I would like to highlight that. Second comment I would like to highlight is that among so many constraints, legislation and so on, you have very often underlined the importance of awareness. I would like to remind that in the coming weeks, we have the annual awareness campaign on AMR. Now for several years, the OIE propose, and that is at your disposal, a lot of communication materials. Please don't hesitate to use them in order to have also additional materials for any awareness campaign you would like to implement in your country, because updating legislation, developing guidelines could take a lot of time, but starting awareness campaign can be done very quickly. Thank you.
Thank you, Dr. Eloa, and thank you to Delphi and Rebecca for the interesting presentation and interactive activity. So I think that now it's time for a short break, and it's going to be a very short break because even if we are not that late as yesterday, we are a bit late on the agenda. So I will give you 5 minutes and then we come back for our last part of this conference, which is on the activities of the regional internal topics of the regional commission and the closing of our conference. So see you in 5 minutes.
Wildlife makes an essential contribution to our life support system.
For example, for local communities who live at the interface with wildlife, this is a main source of proteins.
Without bees, we wouldn't have fruit.
Bats are actually pollinators. They are seed dispersers, and if tomorrow bats are gone, that will affect human health and their domestic animal health. An emerging disease emerging from wildlife, which is called the Nipah virus. It appeared in Asia a few years ago. There was a lot of deforestation to plant palm trees. The thousands of bats had to go elsewhere to feed themselves. So they get closer to human settlements, and particularly closer to pig farms, where there were mango trees and where they could feed. They were carrier of this Nipah virus that eventually were transmitted to the pigs who got sick, and then the pigs contaminated the humans.
The virus that causes COVID-19 almost certainly came from wildlife.
And to reduce the risk of emerging disease and prevent the next pandemic, we need to better understand their origin and drivers. Human activities are the main factors increasing the emergence of disease from wildlife.
Deforestation is one of them, and also the exploitation of natural resources in forests where human beings are not used to go.
Because we have more contact between wildlife, domestic animals, and humans.
One factor that's thought to be related to the emergence of disease from wildlife is the unregulated trade in wildlife. And we still don't understand wildlife supply chains in many parts.
To see what budget get found for this.
Okay, I think we can go back to our agenda. So now we come to the last session regarding the Regional Commission internal discussion. And for this, I'm pleased to invite Dr. Fajer, President of the OIE Regional Commission for the Middle East, who will lead this session. Dr. Fajer, the floor is yours. I think you are mute, Dr. Fajer.
Yeah.
Yes, it's fine now.
Am I okay now? Yeah.
Yes.
Okay. Thank you. Yes. I think.
Sorry, Dr. Fajer. Maybe if you can put your microphone, because we can.
There is another voice with me.
It's fine.
Please.
Yes.
Yeah.
Thank you. It's fine. Thank you.
It's okay now. You can hear
perfect.
me.
It's perfect,
Yeah,
Dr. Fajer.
yeah.
Thank you very much.
I just like the one who's, I don't know who's in. Yeah, that's good. It's mute now. Thank you very much, Natalie. Finally, we come to the end of this conference, the third session. And today I'm going to present for you a very interesting thing and the new groups that will be implemented in the region, and I'm going, which is, we call it Middle East Regional Core Group. In this presentation, I'm going to give some details and about this group. So I'm going to talk about the Regional Core Group, RCG mechanism, and the RCG term of reference, and also the next step of the working of this group. As I say, it's a mechanism, and this mechanism is already implemented in other regions such as Asia and Europe, and that we decided to implement it in the Middle East to facilitate the communication among the region and better support the work of the Region Commission. Whereas further tasks that will be enhanced by the establishment of this group include communication and coordination between the OIE regional and sub-regional representation and the OIE headquarters and members of the region, and also to address the need of the region with the work of the OIE. We have been working in the development of the TORL of the RCG that explain the establishment of the mechanism, its function and composition, as well as the proposal for the work plan framework. The idea is the region adopt this document in order to officialize this communication mechanism, which seems the most appropriate due to time, is that we share this document with all the delegates by email and that we adopt it by email. However, we will define internally and let you know, or option could be to adopt it during the meeting of the Commission during the general session. The first key information included the TOR, the term of reference relates to the function of the RCG are as follows. First, to support the Bureau in specific areas of their responsibility. This will be accordance with the OIE basic text in addition of this TORS. Second function of the RCG is to act as a bridge between the OIE, such as in institutional governing body, which are the Council and the Bureau, and members of the region to inform on such relevant OIE issues, with the objective of stimulating active participation of the region in the OIE event and related activities. Notable example for the annual OIE general session, the annual meeting of the Regional Commission during the general session, and the regional GFTADS meeting. The third function, to improve the region participation in the OIE standards, setting process for selected chapters of the OIE terrestrial and aquatic animal health codes, and manual of diagnostic tests and vaccine for terrestrial and aquatic animal for particular interest to the region. This will be done promoting their adaptation by the OIE World Assembly of Delegates. Furthermore, the RCG may help to facilitate regional common position on key areas of mutual region interest and propose to support the adaptation of these chapters on behalf of the OIE members of the Middle East during the OIE Assembly of Delegates. Fourth would be the raise high-level authorities' awareness of the OIE activities and also importance of the active participation in those activities. The fifth function pertains to producing, based on the proposal received from the members, a list of experts suitable to be proposed as a candidate for the specialist commission working group or ad hoc group and provide it to the OIE Regional Commission for the Middle East for the final validation before the submission of the OIE. The sixth and the final function is to promote active formal and informal communication among all members of the region and international regional organization, using mainly the OIE regional website with a dedicated web page for the RCG during the regional conference, ad hoc meetings, focal point seminars, social media, among others. Another important information that you will find in the TORS is the regional work plan framework. The idea is to define a simple but supportive regional work plan framework that will allows us to better guide the regional commission in accomplishing its role and better support the coordinating of activities in the region, and ensuring that all our regional needs are well addressed and communicated to the OIE. For the development of such a plan that will present to all the members for adaptation, hopefully during our next meeting, during the general session, the following should be considered. The regional work plan framework aims at supporting the Bureau of the OIE Regional Commission for the Middle East in complying with the functions as described in the OIE basic text. It should cover OIE activities, including those supported by the partners such as FAO, WHO, AOAD, EUFMD, REMESA, and other regional networks. The OIE regional and sub-regional representation will support the Regional Commission in the implementation and follow-up of the activities. The third important point is the composition of the RCG, to which the members of the Bureau are de facto members. 2 additional delegates will be included in order to ensure a wider representation of the Regional Commission. The chair of the GFTAD's Regional Steering Committee is also a member of the RCG. The president of the OIE Regional Commission for the Middle East is the chairperson for the RCG. The representatives of the OIE Regional and Sub-Regional Office are invited to take part as observers, and also the staff of the both offices. To conclude the next step and upcoming activities, officialize, adopt the TORS, define the adopt the regional work plan framework. For these 2 points, we will discuss internally and keep you informed by emails. The meeting to come as follows. 2 meetings period the general session in December 2021 and April 2022. A 3rd meeting will be organized during the OIE general session in May 2022 to validate relevant positions, materials, and coordinate activities during adaptation of new standards. The RCG decided to have other meetings on regular basis, monthly or each 2 months, or by email or teleconference to discuss and provide inputs to the Regional Commission. And thank you for listening. So I think I will move quickly to the other session is about introduce the GFTAD's topic and speakers, which will be the topic update, the regional GFTAD strategy, highlight and facilitate the reactivation of the regional GFTADs. The speaker will be Dr. Brahim Ahmed Qasim, is the General Director of the General Directorate of the Animal Resources Service of the Ministry of Environment, Water and Agriculture of the Kingdom of Saudi Arabia. He is also the chair of the regional GFTADS steering committee. Dr. Ibrahim, please take the floor.
السلام عليكم ورحمة الله وبركاته. أسعد الله.
In the name of God, most gracious, most merciful. Good day to you all, and good afternoon according to the timing in KSA. Your Excellency, the Director General of OIE, Excellency, Head of the Regional Commission for the Middle East, and the Head of the Regional Bureau. Ladies and gentlemen, I would like to tackle the different work plans related to GFTADS in the Middle East. Our Regional Steering Committee has been engaged in a number of activities, allowing it to reach its current level of operation today. The GFTADS Committee for the Middle East, or Commission for the Middle East, was established in 2007. The Steering Committee held its sixth session in September 2013, and as a result of the corona pandemic, the RSC7 was held in October 2020 virtually, which highlights the important role played by this committee in terms of coordination functions in the region as a whole. By following on the implementation of the disease control policies and mechanisms. It has renewed chairmanship and members and revised the terms of reference of Regional Steering Committee and Regional Secretariat that has now thankfully become harmonized with other regions of the world. It has supported certain activities at sub-regional levels, and it recognized the importance to work with the private sector and review the priority TADs for the region. It goes without saying that the Regional Steering Committee, RSC, through its regional and international connections, contributed to the consultation process for the development of the new GFTADS strategy 2021 to 2025. So the new GFTADS strategy was launched in 2021 on the occasion of the GSC 12, exactly on the 2nd of November 2021. And the Regional Action Plan for the Middle East will directly contribute to that with the support of the Global Steering Committee. The Regional Steering Committee is also working on promoting exchanges with other regions, like the Arab Organization for Agricultural Development and its different representations in African Arab countries. Through the figure that you see, we can understand that the regional strategy for the next 5 years seeks to promote veterinary services that include a set of objectives related to foot and mouth disease, to PPR, to the Rift Valley fever, rabies, brucellosis, and any new emerging disease potentially. It will adopt a 2-year operational plan and will concentrate on a number of activities to promote veterinary services, especially with reference to countering FMD, PPR, RVF, rabies, brucellosis, and any new potential disease. All of this seeks to enforce gradual control of transboundary diseases. It's important to note that these institutional and fundamental activities concentrate on three main axes that are established through the steering committee meetings related to GFTADs, and another axis is to participate in GFTAD's global steering committee meetings, and the third pillar is to support the General Secretariat. As for the main objectives that we intend to work on in the next 5 years, they include a set of objectives related to combating foot and mouth disease, which is namely to reach stage 3 of the FMD, PCB program roadmap, and to establish the relevant EPI and laboratory networks. So all of this is related to FMD. As for the PPR, the main objective is to reach stage 3 of PPR PMAT and to establish the relevant API and laboratory networks. As for the RVF, the main objectives include the assessment and mapping of the RVF status, which is a priority issue, as a matter of fact, a priority that the steering committee has been following on. Another objective is to establish an active early warning system and to improve laboratory competency diagnostic capacity and to develop the OIE relevant standards implemented by trading partners. As for the rabies objectives, we seek to reduce human death from dog-mediated rabies, and we also seek to offer a potential official control program submitted to the OIE in the next 3 years. In this chart, we have detailed the different objectives that have been implemented in 2021, and we will also share with you what we intend to implement in 2022. First, with reference to PPR, we have conducted a number of workshops on PMAT revision, and this was organized in cooperation with the AOAD, which is another example of positive cooperation that exists between regional organizations in the Middle East, specifically. So this was done in cooperation with the Arab Organization of Agricultural Development, and during this workshop, we have reviewed the regional world map. As for the FMD, we've also conducted a workshop on FMD PCP review, and this was organized by the EU FMD Commission. And we have reviewed the FMD regional roadmap and EpiLab network. Also in 2021, we have organized an inter-regional workshop and we intend to organize another disease control and follow-up workshop this month. As for rabies, we intend to organize another relevant workshop in the future. And with reference to governance, we've also held the RSC 9. As for 2022, with reference to PPR, we intend to organize sub-regional follow-up meetings for GCC countries and Middle Eastern countries. And as for the FMD, we intend to organize sub-regional follow-up meetings for GCC and Eastern Mediterranean countries. Regarding the Rift Valley fever in 2022, we intend to establish a standing support group of experts to support the different regions, member states, and with reference to rabies. Then 2022 will be an opportunity to organize a webinar on control and prevention of rabies, and there will be another follow-up meeting held with GCC countries. And we also intend, of course, to organize the RSC 10. In conclusion, and based on our experience and on following the work conducted by this committee and through the continuous follow-up with the different members concerned by this committee, I can summarize the conclusion by saying that we need additional support from the global level, namely the Global Steering Committee, in order to build our capacities and to advocate regional needs, to work on reinforcing the One Health approach, which is quite essential as this plays a great role in achieving our objectives. So optimizing the benefit of the One Health approach, disseminating it, using it, and ensuring a better control of TADs. It's also important to develop the GFTAD strategy through a regional program, allowing us to meet the needs of different sectors and to ensure the participation of the private sector. I cannot overemphasize the importance of ensuring the participation of the private sector because it's a main stakeholder benefiting from the works conducted by the steering committee. At the same time, success would be achieved by engaging countries in different control measures and offering them the targeted support. This can be done through the proper scheduling of meetings and when we discuss the true needs of member states and when we ensure the proper follow-up in terms of veterinary services and professionals, and to ensure the proper support through the regional advisory groups, as is the case with the FMD and PPR regional advisory groups that do play a significant pivotal role in ensuring a direct line of contact between the regional members and FAO. This is what I have to say. Thank you very much for your attention. Thank you very much, Dr. Ibrahim.
I'd like now to invite Dr. Ghazi and Dr. Al-Hosni to present their respective reports of activities for the region. Please take the floor.
Dr. Ghazi, please, you are on mute.
دكتور غازي انت ميوت.
Okay. So thank you, Chairman, for this presentation. While the major activities of the established in this year during the this year was identified and described by your Dr. Ibrahim Qasim, because it was under the umbrella of the GFTADs. and with the directors of the regional core group, which has been met several times, maybe on 1 month regular. So, but our activities has been based on the strategic objectives as securing the animal health and welfare by appropriate risk management. Through this, we have been to encourage encouragement given to members to participate in the development of international standards and guidelines, as well as the OIE decision-making process. Also, the formation of the new regional core group has been defined by Dr. Fajr. The translation of relevant reports and documents into Arabic. The capacity building program organized in coordination with the sub-regional representation of in Abu Dhabi, and the preparation of the workshop on official and self-declaration procedures to be held in the near future. Joe Haida. So, as for the official disease status recognition, we supported the countries in the region to present their dossier, either for official recognition or for self-declaration, such as the dossier for glanders to Kuwait, AHS and for Bahrain, avian influenza and Doreen, and AHS also for Egypt, CCPP for Oman, and the ADFZ for Syria. Establishing also the cooperation and the harmonization of strategy between members of the Middle East region, especially regarding the program for priority disease, FMD, PPR, viral fever, and rabies, and also identification of opportunity to support members in the regional animal welfare strategy. Within the One Health collaboration, we have talked before on the AMR, and also we have activities on follow-up in the region regarding the MERS coronavirus, including support for research on MERS and other coronaviruses, especially with experts from the IZS and ADAPSA, and the participation in the tripartite regional One Health efforts and the multi-sectoral coordination in Afghanistan, the PBS IHR also with WHO, participation in the One Health issues meeting organized in Jordan and Lebanon on this perspective on zoonosis, and participation in the OIE Interpol emergency management exchanges meeting and follow-up on building resilience against agro-terrorism and agro-crime affecting animals. We have multi-activities on the collaboration with international organizations and regional organizations, especially FAO under the umbrella of GFTAS, UFND on FND and fast diseases, the AOAD especially, and there is one activity we had next week on Rift Valley fever, blue tongue, bovine ephemeral fever, and lambskin disease, the vector-borne disease. And under the auspices of the co-presidency of Spain and Tunisia, we participate in the Remeza meetings. Also for the strategic objective 2, which is the establishing a trust through transparency and communication, high-level communication meetings were conducted by the regional representation in view of their board management of some activity, a meeting with ministers and vice ministers, director generals in the region. It's been held. Also, contacts have been made to include potential assistance to the upcoming tripartite agreement between Egypt, Iraq, and Jordan on safe trade and food security. Continuous updating in liaison with the OIE headquartered in the two languages, English and Arabic, of the new and updated the news and documents on in the regional website. A regular dialogue discussion with others of international and regional organizations, as I mentioned, OIE, FAO, regional offices, UFND, and AOA. For strategic 3, ensuring the capacity and sustainability of veterinary services, continuously we are promoting the use and benefits of the PBS pathway, inviting a country to re-request the missions on PBS to update their situation, because many of the PBS pathway report dated 10 years ago, and we are encouraging also the promotion of the PBS self-evaluation training. There is also the support for the organization of regional and global seminar, including workshop for national focal point. This year it was for animal welfare and for wildlife, and the promotion of the OIE training program ongoing in the region. For cross-cutting areas, promoting capacity and capability of regional laboratory, supporting exchange of studies and research by regional laboratory, the promotion of the project that Jennifer has presented earlier on the Global Laboratory Leadership Program, assistance to the accreditation of a new OIE collaborating center of quality management in Abu Dhabi, and the promotion of scientific excellence in the region through the support initiatives such as CAMANAT and the ACMANAT, encouraging regional researchers to publish studies in the OIE bulletin. Other cross-cutting area is the governance, close collaboration with the members of the Bureau, as I said for this organization of the 16 regional conference, and the organization of a regular meeting of the regional core group on monthly basis, and regular communication with the SRR Abu Dhabi, of course, and interregional coordination with other OIE regional and sub-regional, such as Tunis and Nairobi, Brussels, and now coming the one with Russia also, with Moscow. The maintenance of excellent relations, including the regular participation in national event, and advocacy actions among members, as well as current and potential donors from the region, to encouragement to provide staff on secondment to support the work of the regional representation. Thank you very much.
Thank you, Dr. Ghazi. By this, I have the last point in the agenda regarding this session. I'd like to ask the delegate I'd like to ask you for the next meeting, who's the country willing or interested to host?
Dr. Fajr,
yeah.
There is a presentation of Dr. Mohammed.
Oh, sorry that. Sorry, Dr. Mohammed, the floor with you now.
Okay, now. Can you see the presentation?
دكتور محمد خليها على السلايد مود بليز.
كذي أفضل؟
ما تطلع كامل على السلايد مود خلها.
الآن هي سلايد مود.
I don't know if other can
مشكلة. تشوفوا واضحة؟
هي واضحة بس مش على سلايد مود.
الآن.
Dr. Fajr is saying keep it on slide mode.
Can you see it clearly now?
Yes.
Yeah. Okay.
Yes.
So just to summarize our activities during 2020 and 2021, for those who don't know about our office is established in August 2020. So we are almost 1 year in age, and we did our best to accomplish with the OIE objective strategic and to achieve some activities. So for the first strategic activity, securing animal health and welfare by appropriate risk management, we are really working with our member countries to enhance them to use and consider the OIE standards as a reference document while they are developing their national regulatory documents, as well as we are following the member countries to submit the annual reconfirmations of the official standards and endorsed control programs. Also, we are promote with the member countries to engage in the official disease status recognitions procedure. We pay an attention during this year for several diseases that is considered as important for the region, as well as we involved in the AMR do several activities. For the welfare, we share several activities with the
دكتور محمد ترى السلايد ما قاعد يمشي ما قاعدين نشوف السلايدات ثاني أي واحد.
Dr. Muhammad, we are unable to see your slides. Now we are.
Involved in several activities within HQ, and we follow with the member countries if there is any animal welfare issues, as well as we are in a process to work with or conduct some kind of collaboration with ICFAW. Regarding the strategic objective 2, establishing trust through transparency and communication, we promote about the importance of the disease notification and collaborating with the WAHS team if there is any disease reporting, as well as following with the member countries for any unofficial information. Also, to ease the communications, we established a WhatsApp group for the delegates of the sub-region countries to ease the communication and share the scientific knowledge and events, as well as we are arranging several scientific and technical meetings between member countries to share the knowledge and experience in some specialized topics. For the strategic objective 3, we ensuring the capacity and sustainability of veterinary services. We following with the HQ to conduct during 2022 the virtual PVS mission for the laboratory in the UAE, as well as to conduct another one as on-site for the Kingdom Saudi Arabia. Also, we are encouraging the member countries to apply for a designation of collaborating center or reference lab, and we are following several twinning projects with ADAFSA, which is Abu Dhabi Agriculture and Food Safety, with IZS, and there is another project with ADAFSA with CVRL in Sudan, as well as Ministry of Environment of Kingdom Saudi Arabia with IZS. During this year, we approached several entities, international organizations and national entities to advertising for our office, the role of the office, introduce it to the region, as well as following and discussing the way forward in collaboration with them. So what is activities for 2020? In summary, we are targeting several points: GFTADS, AMR, biosafety, biosecurity, One Health, capacity building, veterinary education, and a best project. Those will be our main topics that we are cascading our activities under them. That's in summary for me. Thank you very much.
Thank you, Dr. Mohammed. And sorry for that. I will come to the last point for this agenda in the session 3. And I'd like to ask the delegate who is interested or willing to have the next regional conference. And I hope it will be face-to-face. So please, Natalie, do you want them to write it in the box chat, or they can raise their hand, or?
They can raise their hand.
Okay.
It's better and present their proposal.
Yeah, I can see Egypt and Bahrain for now.
Saudi Arabia also.
There is no race for them. Yeah, Saudi Arabia, okay. 3 countries: Egypt, Kingdom of Bahrain, Kingdom of Saudi Arabia.
خليهم يحكوا دكتور فجر. أعطيهم الفلور.
Give them the floor, Dr. Faraj.
Okay, please.
Dr. Fajr.
Dr. Abdul Hakim, تفضل.
Dr. Abdul Hakim, I give you the floor, sir. Thank you.
Good afternoon, everyone. Really, it's a pleasure to host the next meeting and welcome you all in Egypt. It's a long time to meet physically, face-to-face. So are looking for your visit to Cairo and to organize this meeting. Thank you.
من سعودي عربيا دكتور إبراهيم راح تتكلم. دكتور إبراهيم والله من مكان الديليجيت.
Dr. Ibrahim, on behalf of the Kingdom of Saudi Arabia, will you take the floor? Thank you, Dr. Fajr. We as well, we will be honored if there is a chance to do so. We will be honored to welcome you. And we really await for that to happen after the COVID pandemic.
For myself, I'd like to also have this opportunity to have this kind of conference in my country, as it was requested 2 years ago, but because of the COVID-19 pandemic, it's been just shifted. So we have now 3 countries, and I think, Natalie, if I'm not wrong, it will be voted in the general session, or we can vote it now. I don't know. You take the floor, please. Help me.
Thank you, Dr. Fajr. No, I guess that you can leave that for an internal discussion with the regional commission. You can also discuss that during the meeting with the regional core group, and the decision can be taken by the regional commission during the meeting, during the next general session, if you think that you need more time to think about it and discuss between you all in the region.
Okay, so I think we will arrange a meeting with the also at the office with the this country to discuss this, and of course we will come with one country or agree with for the one country to vote on one country. We will see what we can do. So thank you for that. The floor for you now, Natalie.
Thank you, Dr. Fajr. I see Dr. Kasim hands is, I don't know if it's the old one or if you want to add something. Dr. Kasim, are you raising the hand now or it's the previous one?
أنا عذرا أنا كان عندي تعليق بسيط.
I had a comment. The last request, Dr. Ghazi, was that we had requested to host and to welcome you for the next conference.
will be decided at the regional commission meeting in May next year. Obviously, we will propose that there is 3 candidates, so up to the regional commission to choose which one.
Okay, so I think we are coming to the end of our 16th conference of the OIE Regional Commission for the Middle East. And for closing this event, I would like to invite first Dr. Monique Eloi, OIE Director General. So Dr. Eloi, the floor is yours.
Thank you, Nathalie, and thank you to Egypt, Kingdom of Saudi Arabia and Kuwait for proposing to welcome the next conference. I hope that will be not a virtual conference. That is really my best wish today. So I will not take a lot of time for the closing remark, as a lot has been already said after at the end of each sessions. Therefore, I will not repeat. Be sure that all your comments have been well noted and that the presentation will be shared in the coming days. So just a few words for, firstly, thank all of you, participants, speakers. You have been very active. The presentation were very well prepared and very interesting. I would like also to thank the interpreters, because the translation sometimes was a little tricky because some speakers express their opinion very fast. Also a specific warm thanks to our President, Dr. Ido Yoga, who joined us from so far. We have addressed the delegates many important topics, important for our respective or joint future activities. That is important also because we are not working alone on our yard. We are more and more recognized as key actors for addressing global health challenges. And therefore, I am very proud to recognize that we are progressively more robust, better prepared to face all these challenges. Therefore, let's stay united to succeed. And I hope that the next time will be a conference in person in Paris, namely the general session next May. I will be very pleased to meet you again. I'm not sure to shake your hand because I don't know what will be the situation at this time, but at least to see you face to face. That is really something I am looking forward. See you soon. And thank you for your participation. That was really a successful conference. Thank you, Dr. Fajer, for having chaired this conference. I will be also very pleased for meeting you very soon. Thank you.
Thank you, Dr. Eloi. And then the floor is to Dr. Fajer for officially closing also this conference. Dr. Fajer, please.
Thank you, Nathalie. We arrived to the end of the regional conference, and I would like, on the behalf of the OIE Regional Commission for the Middle East, to thank the President of the OIE World Assembly of Delegates and the OIE Director General for their participation to this conference. Thanks, Dr. Alwa, for your permanent support to the Middle East region. Thanks, President, for having combined us despite the huge time difference. I would also like to thank all delegates for the active participation during this 2 days conference. We had a rich agenda and fruitful feedback from the region. I'm sure it will be great support for the work of the OIE. I would also like to thank the OIE staff, both headquarters and the regional representation for the Middle East and sub-regional representation in Abu Dhabi, for their support to ensure the success of this important event for our region. And also thanks to all regional and international organizations, as well as observers that combined us during this 2 days meeting. I hope to be able to see you all soon in person, and I wish you a good continuation. I can now finally declare our conference officially closed. Thank you very much.
Thank you very much, everybody.
Thank you.
Thank you.
Thank you. Hope to see you
safe.
soon.
Yeah, be safe and thank you.
Thank you.
Bye.